Welcome to today's meeting of the Health Committee. Now, members of the public may like to follow @London Assembly on social media and use the hashtag AssemblyHealth for this meeting. Please may I remind participants to silence your devices, and the main item on our agenda today is a discussion on healthy high streets. However, we have a few short items of business first. Can I ask our clerk, Diane Richards, to confirm any apologies for today's meeting?
Thank you, Chair. No apologies have been received for today's meeting.
Thank you. We have two members that are due, but they will be here. Can we now come to any declarations of interest, and can we note the list of offices held by Assembly members? Can I also ask members if they have any disclosable pecuniary interest in any specific items listed on today's agenda? No? And can we note the membership chairing arrangements and the terms of reference for this committee as agreed by the London Assembly at its annual meeting on the 11th of May 2026? Okay. And can we note the standing delegations of authority to the chair of the committee as detailed in the meeting agenda? Agreed. Can we confirm the minutes of the meeting held on the 4th and the 9th of March to be signed as me as chair as correct records? And can we note the completed, closed and outstanding actions arising from our previous meetings? Agreed. Can we note the action taken by the former chair under delegated authority in consultation with party group leads to agree the committee's weight loss medication in London report, letters to NHS London and Director of Public Health at all boroughs regarding breast cancer screening, letters to the Mayor of London and the Secretary of State for Health and Social Care on the measles outbreak, and letters to the Secretary of State for Health and Social Care to the Commissioner of the Police for the Metropolis regarding violence and abuse against healthcare workers in London. And can we note the responses received from the Mayor of London and the Parliamentary Under Secretary of State for Public Health and Prevention at the Department of Health and Social Care to the committee's letter on the recent measles outbreak, and also the Regional Director of Commissioning at NHS London and the Regional Director of the Office of Health and Improvement and Disparities in London and the London Borough's Directors of Public Health to the committee's letter on breast cancer screening in London. Great. Now that brings us to today's main item, and I'd like to extend a warm welcome to our first panel of guests today joining us to discuss healthy high streets. So we have Councillor Rag Sandhu, who is a councillor for Bexley-Heath Ward in the London Borough of Bexley and the lead for the Business Improvement District and a cabinet member for the Environment, Culture and Leisure portfolio at the council. Dr. Agatha Naughtley-Meshe, am I saying that right? Sorry, thank you. Who's the Regional Medical Director for Primary Care at NHS England for London Region. Rob Anderson, who's the Research Director at the Centre for London, and William Roberts, who's the Chief Executive of the Royal Society of Public Health. Welcome all to today's committee. So I'll start off with the first question. I'll ask William and then I'll ask Rob to come in afterwards. What are the key features of a healthy high street and town centre?
Thank you for inviting me. So I think the obvious thing people think of when they think of a high street is that you go somewhere to shop and somewhere maybe to have something to eat or drink. But in reality, we think it's far wider than that. And we think there's four key features to a healthy high street. The first, starting with people, is really building your high street with what the local community wants. So I think we often start at a very different point about what retail should be there, what we should be looking at in terms of the mix of buildings, what buildings we have in a space. But actually, if you talk to the community, they're really clear that they want those to be places where they can go and spend time, thrive, engage with other people, and have opportunities to be out and about in their community. So I think, firstly, we think starting with your community is the most important part of a thriving high street. They will tell you what they want, and working with them is really, really important. Then I guess there's three big features we see to that. The first is, how do you get there? So how can people actually get to the high street? We know that 42% of people can't actually get to their high streets in the UK, which is a real challenge. And if you don't have a means of getting there, you're not going to use the services on it. So just straight off, if you've not found a way to help people get to the high street, you're not going to have people using the high street, and that can be both a positive and negative thing for them. for me, that includes three things. Firstly, is there a good transport opportunity there, whether that's active transport, opportunities to be able to get there physically? Secondly, do you have inclusive design that makes it possible for all types of people to attend that area and get into that area? So how accessible is it? And then finally, is it safe for them to go there? Because people won't go if they have either real or perceived ideas that it isn't safe to go to the high street. So work with the community, and then there's something about getting people there. The second big piece is then, once you get there, what is it that's brought you there? And this is where things like retail do become a really big part of it. So we know having opportunities for people to go and use shops, use local amenities is really important. Secondly, the idea of having social spaces. So town centre isn't just somewhere people go to shop or to consume. It's actually a place people go to hang out. And particularly for young people, that's a really big issue when there isn't other wider youth provision available for them in an area. And then finally, the idea that you might actually start to think about services on the high street. If you go back to kind of the 1950s and when we looked at things like new towns and rebuilding and redesign, we actually looked at the idea that there would be more than just shops to go there. You'd have libraries, you'd have social spaces, there would be community groups, there would be youth provision, there would be older people's provision. And so that idea that people are going there, and more recently people are talking about healthcare being for that. And then finally, if you've managed to shape it with people, you've got them there, there's a reason for them being there, how do you actually keep them there? Because the opportunity for it to thrive will only happen if people have a reason to stay. If it's purely transactional, it's very brief, and they're only going to be there for a short period of time, that high street isn't going to thrive. And so for us, that's about food particularly. So the idea that food is a really good way to bring people together. It's a really good social engagement piece, but it's also a great cultural piece that brings people together as communities. Secondly, the idea that it isn't just an urban space, potentially it could be a green space as well. We know that the nature and the environment is hugely beneficial for people's health, and so giving people the opportunity to be outside in and around nature is great for their physical health and it's great for their mental health. And then finally, something about having really supportive businesses on that high street that employ people. You've got to go to any high street, you will see footfall has fallen significantly since pre-pandemic levels. The more time people spend on the high street, the more they're going to spend, the more they're going to bring into your local community, and the more they're going to do to interact with that community. So that would be our view of how you create a healthy high street.
Thank you. Rob?
Thank you very much, Chair, and it's great to be here. Thanks for inviting us to talk about our report on healthy placemaking in London Bridge. So to echo this, so where we came into this conversation about what can constitute a healthy place was about the role of business improvement districts specifically. So we start with the public health literature, which is really, really clear, really, really robust, is that health outcomes are strongly determined by place-based determinants, place-based factors, but also these are multiple and interacting and span different spheres of everyday life. So you've got a complex system you're interacting with. So where you choose your leverage points and the exact behaviours of different actors really matters in terms of the outcome. So that's where we identified a bit of a gap in terms of how we build healthy streets, which is while there's lots and lots of good evidence and guidance out there on the role, for example, that statutory authorities, so public health teams in local authorities, or the health service plays in achieving those place-based outcomes, there's relatively little about the role of the private sector at the local level of how they can use this insight into what drives health at a local level to create better outcomes. So we drew on that literature to develop what we really wanted to be was a kind of accessible and evidence-based framework to inform that thinking. So drawing out what we think the main domains of action for, say, a business improvement district to improve health locally being the physical, mental and social determinants of health. So echoing some of what Richard was just talking about, that's about the possibility of physical activity and active travel, access to healthy food, community connections, the improvements of well-being that comes from strong social connections, all determined by place-based factors. The environmental determinants of health, so all things you can influence, for example, through the quality of the air in a space, noise quality, ensuring that a place is safe. And I'm sure you're already thinking about the roles that a business improvement district can play in these spaces. And finally, the economic determinants of health, so good work, reduced inequality, proper wages, good working conditions. So what our kind of key then was thinking, right, what is the role of the business improvement district and what is their role in these different factors? There are some quite direct routes and some of these factors they can interact with and less direct ones. So one of the things that came out for our work with Team London Bridge and also looking at the activities of BIDS across the city is that there are lots of spaces where BIDS already driving towards creating more healthy streets, more healthy environments. Their role on public realm management, local greening initiatives, crime and safety, and the ability to walk around the space and move a space, active travel. But we also identified spaces where bids could potentially go further. So, for example, about promoting healthy food choices, making sure that you've got a diverse and quality food environment by working with members and working with your membership to ensure as much as possible there are a mix of healthy food options. Roles in community engagement, creating spaces within the areas they manage where you can have that social connection, you can bring together diverse communities which foster well-being. And also, Team London Bridge have done a lot of work on this already, but reducing air pollution and air quality. So what this basically was about is the evidence is very, very clear, and there is lots of it out there. Often the most challenging thing for the role of someone working, whether it's a business improvement juristic, a local authority, or an individual business, is how do I interact with all these different factors? And actually an accessible framework that says a lot of these things are relatively intuitive, and picking your lever is a really, really important thing if you're going to make an outcome for those local communities.
Okay, thank you. And just turning to William, just asking about the role that high streets can play in influencing health outcomes and reducing health inequalities. What roles can they play?
It's a really good question, and I guess it's a choice. And I think this is the thing we don't often see, is people making a conscious choice to decide to use a place to either be health creating or somewhere that makes people sicker. And I think the thing I would say to the committee is there's an opportunity and a choice here to make a decision as to how you want to use your high street. If we see it purely as a place to generate business rates, to bring in money into the local council, we miss the opportunity to think about all the other things it could do as well as bringing in business rates. And I think that's the really first important thing. If we go back to about 2015 when we started doing work at the Royal Society for Public Health on this, we at the time took a slightly different approach to our more recent work on this, and we looked at essentially looking at the shops available on the high street and giving them a score, and then trying to say, well, are places health creating or less so? So, did you have lots of vaping shops and gambling shops and things like that in the high street? Things that the public say they don't really want, to be honest. What was interesting was if you look at that list we did across the nation as where are the healthiest high streets and where are the unhealthiest high streets, it almost directly correlates over inequalities. And so what you saw was essentially the risk of an organisation like mine shaming poorer areas to say your high streets aren't as good as areas that are more affluent. If you want to use your town centres, your high streets, as a place for economic development, growth and the improvement of people's health, you can do so. If you don't, it can really harm your population. And I think that's the really important thing to say. We also know that there's a huge number of assets in those spaces. And the question is, how do you want to use those assets? So this isn't necessarily, people like me often come in and say, oh, you've got to put loads of money into this. You don't need to. It's about looking at what you've got and thinking, how do I take what I've got and turn it into something more virtuous? I'm sure we'll talk later about the role of neighbourhood health, which is a huge opportunity for both London and England to improve health. But, why are we thinking about building new neighbourhood health centres? Why are we not talking about using leisure centres and using libraries and using council buildings that are currently unused and you can't sell because nobody wants to buy them because, high street retail is hard to sell currently at the moment. So this idea that you have a choice, I think, is the most important thing. It's not inevitable that less advantaged areas have to have poor quality high streets with poor quality offers on it. That comes down to how well you choose to create the conditions in which health can thrive. And we know from 150, 180 years worth of evidence in London alone, where my organisation was founded 170 years ago, we know that if you shape the environment to a way that promotes health, you give people access to clean air, clean water, good housing, good leisure opportunities and good work, they're more likely to be healthy than if you do the opposite. And I think that would be the biggest thing I think London councils could do, is think about those as levers of economic development and growth for your community.
Thank you. Assembly Member Best.
Thanks. William, I just wanted to come back to you. The indicators that you have for a healthy high street differ a little bit to the indicators that Transport for London pull out as their indicators for a healthy high street. Now, I was really interested when you started your intro with the most important thing being building the high street with local people, especially when it comes to TfL's definitions of a healthy high street. They don't line up very much with what people want. And if I can give you an example, I live in an outer London borough. It's kind of what I define as an urban village. And recently the council took away 15 minutes free parking, widen the hours for parking, and took away the hour free at lunch. There was a consultation around that. 90% of people were against those changes, and a petition of about 7,000 people signed against those changes as well. Was that wrong, or does the community still win then?
I don't think it's wrong or right, and I think that's where we have to be really careful. Lots of people have different drivers. So, you know, it's easy to criticise a council who's really struggling financially, has had huge reductions in income, about the fact that they're charging for parking, which is where they can raise revenue.
Just for the context, that the decision was not made on a financial basis. It was and they had to outline that in every cabinet report. It's not financial.
Whatever the drivers are, I think the thing that's interesting is how often decisions are made in isolation. So what you've got is you've got your transport system making a different decision to your public health team, which is a different decision again to your economic development team, which is a different to your regen team. The thing we found consistently was there wasn't really anywhere in the country, in the whole of the UK, that could say they'd actually stepped back and taken a real sort of systemic approach to this, where instead of making a decision like you described, where you look at one aspect of this, which is free parking and the opportunity for people to use it, and then said, well, what's the impact of that on the 24 other things? So does that really help us, or does it not help us? And I think the thing that why we chose the things we chose as opposed to any organisation was because we're really lucky we don't have to look at it from a perspective of one bit of the system. Our piece is to say, if you step back and you look at this and you look at transport, but you look at transport also in relation to car parking, also in relation to trains, also in relation to buses, also in relation to walking and roads and road safety, all of those things together are things you can start to do. But also, ultimately, what you're asking lots of organisations to do, whether that's from central government or local government, is to make a decision within their department rather than make a decision across the departments within that organisation. And so if you start from a different point, which is why we start with community and saying, what do you want from it? There's still going to be trade-offs, and it might be that you still don't get to have your 15 minutes free parking in your area, but if you've made that decision in the context of every other opportunity you have to make it easier for people to use that high street, that's really important. And it might be that part of this was actually pollution in the area, risk to children being, you know, road accidents in that area, for example. There are lots of reasons why you've made it. But the point is often those decisions are being made in isolation rather than being made as part of a bigger picture that people are looking at. And I think what we would say to people is, can you, particularly in councils where you have this opportunity to look wider, step back for a moment and say, how do I see this high street regeneration as something more than just transport, more than just shops, more than just restaurants, more than just nighttime economy? And that hasn't been done today anywhere in the country as far as we can tell.
But it would seem to me then that the community in this example and the residents, the business owners, the consumers are saying one thing very strongly, and the step back approach that you seem to be talking about seems to say to them very directly, yeah, I know you want that, but no, we're looking at the big picture and we know better. So I don't think they would see that as building with what the community wants. That's a very hard sell.
So I don't think it's saying, what does the community want? It's saying, what do you want from your high streets, which is a different question. And people don't ask that question when they start the consultations. What they ask is, what should we do about empty shops? What should we do about this bus route? What should we do about this car parking? And my question is to stay back and say, what do you want from your high streets overall? That's the bit we need the public to define. You know, and so if you go back 10 years, 15 years ago, when London councils were looking, for example, at lunch club provision, it was one of the first things that got cut as the budgets went, because there was very little evidence that older people benefited from lunch club provision. Part of the reason for that was because for a very long time they'd existed and nobody had ever actually bothered to evaluate whether they did anything. But the minute you removed that, you suddenly saw there was a real challenge around loneliness and isolation in that group. And this is the challenge of not actually looking at these things in the round. If you look at these things in isolation, you can find an answer that will fit what you want to do. If you look at it in the widest, biggest picture of what is a high street there for, rather than why do we need X, Y, or Z on the high street, you come to a very different set of answers. And when people have done elements of that, you can see better design, better opportunities for people to work together, better opportunities for cross-organisational improvement that ultimately has an impact on people's health. You know, I gave the example of neighbourhood health. the challenge now is for the NHS not to go and build new health centres on the high street. We don't need that. We need to use the community assets that are already there. But if you ask members of the public, do you want more NHS centres on your high street, the answer to that will be yes. How you ask that question really matters. Because if you say to them, would you like that to be available in your local library, in your local swim centre, in your local gym, the answer often comes back yes. But if you don't ask the right questions, you get the wrong answers. And that's my challenge back to councillors, is go and ask the right questions. Don't ask a question that says, do you or do you not want parking? Because most people will always say they want parking, because cars are the normal way in which we travel around because of the absence of anything else in the system.
Just on that point then, in your Healthy Street Index that you give, is there a place for car parking in healthy high streets?
Yeah, absolutely, because it's about accessible design, but it's also about giving people other choices. And if your predominant way in which you access your high street, particularly in London, is by car, that takes out a huge number of people attending that high street in the first place. So we know that essentially ensuring good bus routes that are accessible, ensuring that trains are accessible in those areas, that there's walking, that there's cycling. You know, if you talk to parents about why they don't take their children to school by bike, they're worried about their children getting run over. And so they go in a car themselves, which increases the number of cars, which means you're more likely to see children getting run over.
Yeah. Horses for courses, though, right? We're talking about the difference between central, inner and outer London. Some places in outer London, for example, they don't have that busy kind of high street feel or danger feel. So, and also cars, I imagine, in central London are less the norm, where everything is within.
So as somebody who lives outside of London and doesn't live in a London borough, cars are a really important part of where I live. They're not the only way in which you can get people there.
Yeah, of course, but I'm talking mainly about the figures between, and car ownership between central, inner and outer are wildly different. So it's kind of...
Yeah. And this is back to what matters in your local area. This isn't... Our blueprint isn't saying everybody has to have this. It says these are the ways in which you build your high street, and that might be different in different parts of the country.
Yeah. If I could come over to you, Councillor Sandhu, and ask about Bexley's work to build healthier high streets. What's been the impact of your work and where you've started with that?
Thank you. Firstly, thank you for inviting me along today. So just touching on a couple of points, if I may, which William made there earlier. So parking is a big thing, because in an outer London borough, it is challenging. We have I think it's one of Europe's biggest shopping centres, which is Bluewater, within a stone's throw away. Free parking, you can park there all day long. However, within Bexley, you need to pay for parking, so, you know, irrespective of where you are. But so I do think I can see your point, but there is a challenge there. And the challenge is the fact that what works in inner London does not necessarily work in outer London. And as a result of that, the outer London boroughs do suffer a lot because of various layers that there are of legislation and different aspects there. But one thing we've done in Bexley to keep our, certainly in Bexley Heath, which is, I would say, is the flagship high street of the borough, which is the Broadway, we've utilised the bid in such a way that they're doing a lot more than just focusing on retail. So we have night markets, we'll have summer markets, we'll have themed events throughout the year for, I'm sure they're doing something for the World Cup at the moment. Easter, they'll do something, you know, all of these different things. They're bringing a fairground just to bring in additional footfall, because we all know right the way across, not only the country, but actually across the world, shopping has changed. The high street has changed a lot due to online orders and everything else. So as a result of that, you need to have something there to bring in people from outside the borough. Now, just touching again on the transport side of it. So again, we mentioned earlier about transport hub and buses and everything else. Well, on the Broadway, we've got the hub. So we get thousands of children every day, Monday to Friday, during term time, come there to obviously get on their buses. I wouldn't even like to hazard a guess how many thousand. It's probably a good 3,000-4,000 children, I would imagine, that come from all different schools, all to this hub. And you can imagine, if you're you're used to a certain routine, you're going to go shopping at a certain time, etc., etc. Sadly, some of the residents will not come out because all of these kids are congregating at one place at the same time. So that can be an issue. And then I know in some of the paperwork that I read in preparation for today, the Mayor of London talks about safer high streets. Safety is a huge thing for everyone. But in Bexley alone, we've actually lost some of our town centre team police officers. So what's happened is the bid have now had to bring in external security at a cost of around £80,000 a year, just to keep the high street safe and secure. Sadly, there is a trend at the moment, pickpockets and all this kind of stuff. So we've brought in an independent team there just to make sure the high street is secure. Now, if you think, we're here today to talk about healthy high streets, whether it's healthy in terms of food, mentally, in terms of the offers that are available. But if it's not secure and you haven't got safety, that's a massive issue. And that £80,000, as an example, that we're spending on security could go into different events on the high street to bring in the extra footfall. So there's a whole different challenge of things here that I think do seriously need to be addressed, because it's a knock-on effect. It's not just a case of fill the shops with whatever and then just see what happens. It's having the variation, having the different options available, not only for residents, and then just touching on something that William said earlier about making use of existing council-owned property, like the library as an example. In Bexley Heath, for many years now, we've been using the library as not only a safe place, but a warm place. So in the winter months, some of the, if you want to meet up for a coffee or something, they have free tea and coffee there at certain days of the week. Certain groups will come in, they'll have a knitting session or whatever. There's a real hub there for these community groups. And I think it's all of these little things. The resources are there, but it's a case of making use of it and how are you going to package it. And I would strongly suggest, I don't know how many other local authorities there are that do this, but I would strongly welcome you to come down to Bexley, have a look at how we do it with the limited resources we have, because if it works there, I'm very confident that should be able to be rolled out further afield.
Could you just say a little bit about how Bexley Heath has recovered from the pandemic? Is it, how the high street was pre-pandemic to how it looks today?
It's thank you for that. It's changed in terms of offer, I would say, in terms of some of the retailers that we've had. We're fortunate. We've still got some of the big multinationals are still there. But again, as I mentioned earlier, there's shopping trend has changed a lot. I do think that the offer that we offer there, in terms of other external events, have changed it probably for the better, actually definitely for the better, because you're just offering different things. And the retail outlet, the retail side of it has changed very slightly. I wouldn't say it's changed massively, because we've still got, Morley's, we've still got Marks and Spencer's, so we've still got some big stores there. Primark is another one. Again, that's just a classic example, because that is a real draw to bring in people. I mean, apparently the bigger the Marks and Spencer, the Primark store, the more footfall you're going to get. B&M was a classic. They opened just after, I think they opened in 2023. I couldn't believe it. There was queues of people just to get in there. So it's having the offer. I mean, B&M is one that definitely I remember came in after the pandemic, and that made a big difference. But certainly in terms of the bid, the offer, different things like Transformers, they'll come along and they'll have a show there, and the kids will come along. They'll have a classic car show. They do outdoor, music events and things. It is just a case of getting extra footfall. And the other big thing, I think, is that something that we're really proud of in Bexley is our social media presence, because there's so much different social media out there at the moment. Can be hard to believe, but the thing is, with the Business Improvement District, they are always pumping out, this is happening this week, this happened last week, etc., etc. Look at the footfall. It does make a huge difference. So I would say the retail outlet has changed slightly, the offer, the bid events, and obviously the social media has made a huge difference.
Thank you.
Thank you. Very quickly, I'm just going to come in and ask a question, Councillor Sandhu, about the healthy catering commitment. You mentioned some of the food outlets. Is that something that Bexley runs or promotes?
Yes, we do. So we do have some healthy permanent outlets there, but then in addition to that, we will have on our street markets food markets will have a whole range of different stuff. And most of it, I would say, maybe not all of it, but a fair chunk of it is healthy because, again, there's a huge trend that way. It could be anything from, a nice healthy wrap through to a smoothie, but there is a huge offering of that.
Okay, and are they, is that through the accredited Healthy Catering Commitment Scheme, or is it just something that's naturally come out of what's on offer?
That, as far as I'm aware, has come out naturally, purely because of supply and demand, I would have thought.
Okay,
Thank you.
Assemblymember Russell.
Thank you. William, you were talking earlier about thinking about the combination of the sort of economic sustainability of high streets and improving health, and that they can have both those functions. And you were talking about the fact that it's not inevitable that poorer areas have poor quality facilities, and that you can shape the environment to improve health, which feels like sensible thinking. So I'm just wondering if you've got anything to say about how local authorities can use their particular powers to build healthier high streets.
So the first very simple thing is to actually think about it from a whole council perspective. So this idea of not just seeing the responsibility of shaping the high street as sitting with any one part of that organisation. So I think that whole government piece and the whole local government piece is really, really important. And public health directors have a massive opportunity and role in supporting that across government. They are experts on this within your council, and so drawing on their expertise is really important, I think, the first thing to say. Councils have a range of powers. They don't always use them in a consistent way. And so a really simple example is licensing. So where you choose to put your licenses, how you choose to use them, can be a really powerful thing for both ensuring the right kind of mix of things, some of those safety issues, for example, the use of dispersal zones and all sorts of interesting things can be used in different ways. And if you go around the country, or you go around different London councils, the future's somewhere in every single one of them. There's not one place that's doing everything they can do. And so there will be councils who are doing more and doing better on community safety. There will be others that are doing more around healthy food outlets. There will be more that are doing things around inclusive design. And so this opportunity to use different bits, and London is fairly unique in having this opportunity because it has so many different test beds. You can go somewhere and pretty much find somebody who's done something you want to do to make it better. So the question is, how do you do that and how do you compound that? I think the other bit that's really important and really underseen is that high streets are a visual metaphor to the public for decline or success. We did a piece of work a couple of months ago on public toilets. Very simple piece of work where we just looked at availability of public toilets in a local area. Really complicated how you start to do it, some great solutions in the public toilet piece, but actually it's a huge barrier to people going out onto their high streets. But it also is a sense that nobody's investing in stuff that will make me go here and stay here. And so one of the things I would say is there's a real civic pride opportunity in this for councils, which is really understated. Those events, those really valuing it. The days of everybody having, a high street that's got big supermarkets and big brands on it is gone. And that went 30, 40 years ago with out-of-town shopping and shopping centres. So it's reimagining that for the 21st century for me. And so that piece about coming in and saying, what could we do differently in our bit of town that works for us, that is localised to us, because it isn't going to be the same everywhere, but the powers council has are the same everywhere. Mm-hmm. Not everybody's using the powers to the top of the register for good. There's also real opportunities to think about economic development in this. You asked a question about healthy food. That's entirely a choice about two ways in which you can make sure there's healthy food on your high street. One is decide who gets on the high street in the first place through licensing, so don't allow lots of really unhealthy outlets to be the predominant food offering. The second is then to work really brilliantly with the local existing businesses to improve their offer. And often in many boroughs, there's really great offers here, and this can be about ensuring that there's things that work for your community and shops that are available for your community that stock the products you want. So there's a huge opportunity for businesses to actually make money on this, you know, and reimagine the high street not as a place you go to do your shopping, but as a place you go to do your local shopping and your local stuff. And that's really important, because people talk really glowingly of a great local high street. And there are places where they've done some really good work on this to think about, we're not just going to have vaping shops and betting shops on our high street just to fill those empty, vacant lots. We're going to think really carefully about the curation of that high street. And that, for me, is the critical bit. It's the curation of it, and who owns that curation isn't entirely clear at a local government level. It sits across 10, 12 different departments.
Just want to go back to the toilets for a moment. It's
Yeah,
something
go
I
for it.
care about passionately. And we know that older and disabled Londoners, but also just people at different points in their life with experiencing different health conditions or being pregnant or whatever, may have more urgent need to find a toilet. Now, my next question was about do councils need any additional support in terms of funding and statutory powers? Now, this committee made a recommendation when we did a report on toilets and the lack of public toilets about the need for there to be a statutory duty on local authorities to provide a certain number of public toilets, and obviously with government funding to enable that to happen. Is that something that you think the committee made a sensible suggestion on?
Yeah, I think it's a sensible suggestion. I think the flip side of any recommendation like that is you've got to be able to realise it and actualise it for people locally, because in the absence of lots more money, you know, public toilets are quite expensive. It's about £15,000 a year to run a public toilet. So, you know, if you've got really cash-strapped councils who are struggling to provide adult social care, which they are required to do so by law, it's much harder to then say, well, why would we discretionarily spend money on public toilets? So, you know, there's something about this. But what was interesting is, again, if you look around the country, if you look at places, there's really interesting things like brilliant shops, making sure it's signposted when their toilets are available to the public, making sure that if you do have public toilets already, protecting them instead of selling them off. If you're doing redevelopment, ensuring that part of the Section 106, you know, is actually used to put in public toilets that can then be maintained through that. There's public-private partnerships that have been done around funding those toilets. So there's lots of interesting things you can do. I think it's good. You know, we would definitely, and have in many of our reports around high streets and other parts of the public realm, talked about giving more powers to local government. I do think that's a fundamentally good thing.
And
but I also
which
think
powers, are there any particular powers?
So you mentioned a statutory power to require people to have it, but also a power that would compel developers to work with local government, for example, when they're developing an area, to ensure that there's public toilet provision. Is a really simple thing you could do. Really simple. The challenge, though, is there's no point in putting in more powers when you're not using the ones you've got already, and there's no point in selling off your assets and then saying it's a shame we can't replace those assets. And so for me, this is about, you know, we have libraries, for example. Why are we not looking at saying, well, libraries could also have a public toilet provision within them for people? We know that leisure centres, you know, I could talk all day on these brilliant things you see around the country. In Plymouth, there's an amazing leisure provider who knew that they had times at which their leisure centre was not used by people. So their OPEX doesn't change, right? They've got to operate it for those hours anyway, because it's contractually required. It was an empty building. So what they do now is they provide swimming sessions for people with Parkinson's, whilst also running a Parkinson's clinic. There's two good reasons why you do that. Firstly is because it's moved the health onto the high street and allowed them to see more people, and the specialist Parkinson's nurse can be there to see the Parkinson's patients who are coming into that. But we also know that swimming's positively beneficial to Parkinson's itself. It helps you manage the condition itself. So it's got a really positive, virtuous effect. But the real advantage for that business was they suddenly got footfall, and if 1 in 4 people buys a cup of coffee, that increases their turnover, which manages their OPEX issue. So these creative ways in which you can make stuff really work brilliantly for you. Why are we not also talking about ensuring that the gates that allow you into the leisure centre are the other side of the toilet, right? Because you go in and you've got to go through the gates, but why not, when you're building those kind of provision, make sure there's some way to get to the toilet? Just really basic things like that you could do that just massively improve your public realm. And tells people I care, which then means they care, and so they give back to that local area and care about it more.
Thank you. That's really helpful. And back to you, Chair.
Thank you. Councillor Sandu, you want to come back just on that point?
Thank you. Yes, just on that point for Assembly Member Russell. Yes, just to sum it up, I think you have made the right decision by asking for things like toilets, etc. But all I would say, as a councillor, it's great, but please make sure that when we do ask, that there is some kind of funding attached to it, because the last thing you want to do is put that on as a statutory thing and then not have any funding to it, and then it just goes round full circle. Thank you.
And I think the point about that kind of creative thinking, actually getting local authorities thinking about putting the toilet, making sure that toilets in leisure centres are accessible to the public, not just the people who are paying to use the leisure centre, that's a great idea, because that it's a public building. It should have sort of public health at its heart, and access to toilets is a public health issue. But thank you.
Thank you. Assembly Member Best, you had a supplementary.
Thanks. Just coming back to you, Rags. The government funding formula, some would argue, penalises councils for undercharging on things like parking. So that means, for example, in your neck of the woods, where you're competing with Lewisham and Greenwich, but don't have the transport links with them, how's that affecting you with your ability to balance transport to your high street?
Well, in Bexley, we've obviously had that dreaded word ULEZ, which does affect us, because where we are, obviously we touch on to Dartford and Gravesham and everything. The problem we've had, and it is an ongoing issue, is yes, we don't have no underground obviously going there. We only have just your normal mainline train stations. We now have the Superloop and bits and pieces, but a lot of people, a huge amount of our local residents are dependent on their cars, because we just do not have, it goes back to what I said earlier about what works in inner London doesn't work in outer London, simply because the infrastructure and the transport links are not there. So it does have a huge impact on us. But then at the same time, what we need to sort of figure out is, and I don't know how exactly we're going to do this, is that we need to find like a middle ground. But how are you going to find that? Because people need to use their cars to get from A to B, and when they get to the shopping centre, as an example, they have to pay for parking. They could go 2 miles, 3 miles down the road to pull up at Blue Water, spend the whole day there, free of charge. So there is that we need to sort of somehow try to balance the books. It does put huge pressure on us, because we have to charge for parking, because if we don't, we're going to just go in the red, and we obviously don't want to do that. So there is that pressure there about making the numbers match and balancing the books at the end of the day. And it does put pressure on us as a local authority to have to charge. We don't want to. But a classic example is somewhere like Bexley Village, which is one of the smaller parts of the borough. There's a traditional, what I would say, a very traditional high street there. So you've got one butcher, one barber, etc., etc. I don't think that they've got any free parking there at all. So what's going to happen with that is people are going to think, well, I'll tell you what, I'll just carry on down the road for 2-3 miles, end up in Blue Water, and I spend the whole day there. And that is going to be the decline of that high street, because that's a village location, just as an example.
So would you welcome changes that allowed you to give a better parking offer? Because, like I say, the current funding formula seems to penalise councils if they don't charge. And you touched on it briefly, but just obviously Bexley took TfL to court over ULEZ. Would you welcome more powers to opt out of that to protect your high streets?
Definitely, without a shadow of a doubt. And I know we've had this conversation at different levels, different meetings. It just goes back to what I said earlier. What works in inner London does not work in outer London, and that was our argument all the way through.
Thanks.
Thank you. Assembly Member Ahmad.
Thank you, Chair, and my apologies for lateness earlier. Good morning, panel. My question is to Rob Anderson. Rob, what actions can business improvement districts take to support healthier high streets? So we had some examples from Councillor Sandu. Just if you could give some examples around London Bridge as well, which is part of my constituency in Southwark, I'd be grateful.
Yeah, absolutely, and thanks for the question. So just going back to my earlier remarks, I mean, the key is for business improvement districts to ground their work and what they do to improve health and wellbeing locally in the evidence base. And one of the things we wanted to bring out in the work we did with Team London Bridge is that doesn't need to be super complicated. So you can synthesize the public health literature. It's actually all quite intuitive. You kind of get, good quality air, walkable spaces, ability to move in and out, good jobs, diverse high street. The question then is how business improvement districts can then pick which levers they're going to pull. How are they going to work with their membership and take the resource they have, which isn't infinite, of course, and where can they best complement other activities such as those delivered by the Transport Authority or by the local authority. So what we came out with Team London Bridge was that there were lots of spaces where they were doing strong work already. So, for example, around promotion of active travel and reducing emissions, they have a cargo bike hire scheme, which is very well used and very well promoted by local businesses. So you're reducing traffic, you're reducing air pollution and noise pollution. They're already doing some interesting work around promoting healthy food choices for a deal card. And what that was, it just meant they were surfacing healthier food options and working with some of those specific retailers to offer discounts to people working in the area to be able to access those healthy food options. See, none of this stuff is super complicated, super technical, but it's about being able to engage with those factors and go, okay, how could we do something about this specific intervention? Another area where we thought they were already doing some quite strong work and they could go further was around the weather resilience of the area. So in an area where we're going to see increasingly hot summers and more intense rainfall, their work around sustainable drainage systems and increasing foliage cover, so the environment is more pleasant, but it's also more resilient to weather. And again, all relatively low-cost interventions. And then in terms of the feedback loop to their membership, so ultimately who they're accountable for, they have to, those levies are paid by the members, is the key was the co-creation work that we did with their membership about bringing them into the process of picking out the ideas, and they were the ones generating some of the ideas. And also now they put that into a rhythm where they're doing that annually. So they're using the framework to go back to their membership to be able to go, okay, these are the kinds of things we've done, doing some surveying work of both people who use the area but aren't members of the businesses, but also people who are working for the businesses in the area to see where they could improve. So, for example, we did quite a simple survey. We had about 400 responses from people using the area around their levels of how close were they to the 150 minutes a week of exercise. And discovering they were, on average, they were a little bit lower. So Team London Bridge are focusing on that. Like, what are the opportunities, like gentle nudges to make the environment a bit easier around the London Bridge area to go for a run at lunch? And one of the things that came out there in terms of the surveying was, for example, people not feeling safe when it was dark. So they have a partnership with the Met. They're funding a bid-funded police officer. They're working on the street lighting, all these things that you can track back to the health outcome. But the key is being able to ground it in that understanding of the health outcome and then working with the membership, working with local communities, having like relatively light touch bits of evidence, like just doing a routine survey on people's health behaviours in the area to go, what could we do about that?
Thank you. And I'm actually doing quite a bit of work at the moment around the Transport for London road network, which significantly impacts my constituency and that particular area, going through Borough High Street as well. Just wonder, are you actually having conversations with TfL? I mean, you talked about making it easier at lunchtime for people to go for a run. Road safety is a massive issue in that area, and I wonder what kind of conversations you've had and what results you've had as well.
So in the co-creation workshops we ran, co-hosted with Team London Bridge, we did invite TfL along, and we also invited the Highways Authority. And this is it was actually on the discussion earlier about contestation of space, about different users have different needs, whether it's the need to be able to park your car for accessibility reasons or because the infrastructure doesn't suit your needs to come to the high street. Having good quality engagement processes is how you surface those contestations. So, I mean, I think London Bridge is a really, really good example of an inner London complex environment where you simultaneously have residents very nearby, people literally live. There are lots of people who still live in that area. It's not just a business district. Lots of people work there, but in very different kinds of firms. You've got some of the biggest firms on earth, Cheek by Jowl next to like the Body Shop in terms of kind of local, more high street retailers. And it's also a tourist destination. So you've got to think about all those users. So thinking about the ways in which conveners like business improvement districts working alongside local authorities and statutory authorities can hash out those contestations, those inflection points about how do we use this space, how do we maximize the public good, and where are the trade-offs, and how are we going to reconcile those? So those were some of the more robust conversations, because it was just a straight up difficult conversation about, if you were just listening to, say, Business Improvement District, talking about the people who want to be able to get the train into work and they want to be able to walk precisely to their desk without having to cross the road, then, of course, if they had the powers, they would just do that. But we can't do that because it's London Bridge, and we need to be able to have through for logistics, etc. So those engagement processes and those consultation processes and co-creation is a really, really important way. And there's never going to be an answer that suits everybody. But grounding in an understanding of what the overall health impact of different interventions might be and what the trade-offs are, we think is a really good route to be able to produce better outcomes.
Okay, thank you very much. Thank you, Chair.
Assembly Member Russell.
Thank you. So I've got some questions on neighbourhood health centres for Dr. Agatha Naughtley-Meche. So the first question is, why, in your opinion, is it important for neighbourhood health centres to be located on or near to high streets?
Thank you. Thanks, Caroline. I've been literally jumping the conversation, so thank you for bringing me in. And actually, it's really interesting. I did come to talk about neighbourhood health centres, and I will, but actually, everything we've been talking about so far is neighbourhood health. The health centres are a very small bit. And absolutely, they need to be where people can access them. But they're not. Neighbourhood is not just NHS. Neighbourhood is whole system. It's about the community. It's about reducing health inequalities. It's about wellness. It's about bringing together the bits that sit within local authority and voluntary sector with the bits that sit within NHS. So we know, for example, air quality we've talked about, that links to respiratory health. And, I can't give people lots of inhalers if the air quality isn't great. I'm not going to make them any better. So there's something about how we work together to create wellness in our communities and how we work across health, local authority and voluntary sector. So part of the work that we're doing in London is around creating that neighbourhood health model, of which the neighbourhood health centres will be one. And there's a piece of work just starting to outline what they might be and what they might look like. So there's a London Neighbourhood Health Hub framework being designed as we speak, and I think there's a high-level version that we'll be happy to share with yourselves. I think the key thing, and you've challenged me a few times about should they be new buildings, there isn't any money. They can't be new buildings. It's not going to happen. So we're going to have to get creative about how we create these neighbourhood spaces. That service that you described, where the leisure centre is doing those Parkinson's swimming sessions and bringing the nurses in, that is neighbourhood working. And it's not unique. There's lots. There's a leg clinic in Sutton that has been designed as we speak, where they've actually got a community centre. And what they do is all the patients that would have been housebound, that the community nurses would be going around doing their leg dressings, they're picking them up, and they're bringing them to this centre, and they're giving them a cup of tea and some biscuits, and they're having some community interaction and being able to talk and laugh with others where these people would be isolated. And the nurses have a more efficient job of being able to dress their legs at the same time. So, and then also there's learning opportunities. There's so much benefit for everybody from those kinds of models. So actually, how are we being creative around the buildings that already exist on our high street, close to our high street, that are accessible, that people already use and go to, that people already trust, and then building those combined health, social, voluntary sector initiatives around them. So I think that's the kind of thing that we're doing. I don't know if that kind of answers your questions in a roundabout way.
It answers many of my questions actually, all in one go. Yes, I mean, you have literally answered my subsequent question.
I didn't read them in advance, I promise.
So are there any additional things that you would like to see from the Mayor or from London boroughs to support the rollout of more neighbourhood health centres? It seems completely, I mean, that idea of bringing people to a centre so they get that human interaction, a cup of tea and a biscuit, that is incredibly important for older people. I know, having been a councillor for the last 12 years, the number of constituents who are elderly and incredibly isolated. So that just seems like a really practical, sensible thing. It actually feels a bit call the midwife.
Oh, it's fabulous. You want to see, there's a community cafe in Orpington that, again, the elderly community come to once a week. tea and biscuits, but also they've got an art class. They always bring someone from the PCN, so they have community pharmacy or podiatry or someone to come in and talk to people, but also to sit in the corner and do a little clinic. They have to play bingo. But actually what it does, it gets people out of the house, it gets people talking, it gets people interacting, it gets people as mobile as they can be, and they're not at home deteriorating and getting frail. And if someone doesn't turn up, it's, oh, where was Susie today? Should we go and check on her? So, sorry, but it gets me very excited. But absolutely, there's a lot that we can do. So what I would say is we already, in fact, Tom, the Mayor's Health Advisor, Tom Coffey, is one of my close friends, and we work very closely together. We were talking at a summit together earlier this month, and some of the things that we've been talking about is how we bring everybody together. We have a Pan-London neighbourhood programme and board, and we've set it up because we recognise that it's a whole system approach. We have GLA membership on it. We actually meet in London Council's offices. We have voluntary sector colleagues, we have NHS colleagues, we have other kind of wider partners and stakeholders around the table. And we've done it in that way because we recognise that we cannot do everything by ourselves. It's got to be done in collaboration. And we know, obviously, the 10-year plan mentions some of it, and some of the National Neighbourhood Framework mentions some of it, but a lot of those documents are very NHS heavy and healthcare heavy, and they don't talk about the whole system. So we set up this board, and underneath the board sit a number of subgroups that are really around building that infrastructure, but they are all, again, multi-agency. And what we realised is, because what we realised was last year, before the 10-year plan, I hasten to add, London did it first, we put together a target operating model, first a case for change and then a target operating model that described why we need to do this for London, what is different about London, and even across London, the kind of inequalities and different experience in different places, and why we needed to do something differently. We recognise that there are lots of amazing initiatives where people are trying to work across their organisational boundaries to do the right thing, and it's not the inability to integrate that is the problem. It's the lack of infrastructure to integrate that is the problem. So we don't have systems that connect us. Our digital and data systems don't connect us. We don't have good ways of commissioning services across, for example, health and social care, and so we can't even pool funds to do things that actually cut across in the right way. So what we did is we set up this neighbourhood board, as I said, multi-agency, and underneath it we have a digital task and finish group, or subgroup. They're not really a task and finish group, an estates subgroup, who are the ones that are designing that hub conversation and framework. There's one around commissioning and contracting. There's one around people and workforce, and there's my favourite one, which is actually the one around how we are engaging and co-designing with our people. And that's got a deliberative arm, so people and public deliberative working processes. There's a community of practice for the people who are currently trying to deliver neighbourhoods despite the lack of infrastructure, to tell us the problems that need to be solved so that we can apply the clever brains of the people on these subgroups who are good at digital and good at commissioning and contracting, etc., but don't necessarily understand from the ground up what neighbourhood is, to do that. And also the site visits, so the board members can go out and see what I see when I go to Orpington and to other places like that. So we've set that up so that we can start co-designing and fixing the infrastructure that will help with neighbourhood development.
That sounds absolutely amazing, and particularly the piece about co-design, because certainly on other committees we've done work with Inclusion London and heard loud and clear about the need for that early engagement with deaf and disabled people's organisations, so that you're not kind of retrofitting changes to services, you're actually building in their needs from the very beginning. Thank you very much. That was really helpful.
No worries.
Back to you, Chair.
Thank you.
Thank you. Assembly Member Wilson.
Thank you, Chair. And good morning, panel. So my questions are going to be around the availability of different sort of food options on the high street and how that impacts healthy eating, healthy living, and what we can do to influence those. So I guess firstly, to William, trying to understand more about how local authorities can support healthier food options. And I guess the first thing, sort of thinking about, I guess, more sort of formal sort of planning powers and where those have been in effect. So I think London Plan Policy E9, and I know other local authorities have had similar things looking to restrict the proliferation of takeaways, particularly around schools. Where that's been implemented, how effective has that been so far?
It varies. It varies hugely, and it varies hugely depending on what you already have there. So the biggest challenge is like you're often dealing with what you've already got. So it's very hard to make a case for not wanting a greater density of fast food outlets when there's already lots of fast food outlets. And we know that when that's gone to legal reviews of this, that's where the big companies have pushed. I think what's important to say, though, is predominantly that's used against big multinational companies. And for me, there's a kind of, if you like, there's an interventional thing of trying to get councils to stop lots of fast food outlets coming onto that. The other version of that is to encourage local businesses to do it, because they will be a healthier offering on the whole. They're not going to offer things in the same way as a big multinational corporation is. They are more amenable to working with you around things like the type of food they will sell, the types of opportunities they have to improve it. And so I think, there is the option there to restrict people coming to High Street. I think it's important people use that, particularly when you are looking to support, a healthier local community. And those powers are there. They're not used very consistently, and we don't see necessarily the learning that you need. So people who've been through that, what would you do differently next time? How could you apply that in other areas? But I do think that the other version of this is we have to get back to high streets being local. That's where your opportunity to make something better is. Whether that's seeing your local GP, whether that's your local councillor being available, whether that's your local shops being available, or your local restaurants. How we encourage through economic development opportunities to get the right people onto your high street really matters. And so for me, going in and trying to stop stuff is always harder than trying to do something very positivist. And I think the thing I would push people to do is to think of how do we think about encouraging the right types of people to become part of our high streets, rather than how do we stop the people we don't want on our high streets. You have the powers there. The powers can be used. There are some really good examples of where it's been used across the country and that have been successful in doing it. So you can get those wins. But actually, for me, I think the piece that's really under thought through is how you encourage different types of people to come into your area, particularly local people who will keep their money in your local area, generate local wealth for you, and keep that pound in your local area, combined with you've got some brilliant local smaller organisations. How do we make it as easy as possible for them to improve the healthiness of their offer as well? And there are things I think you can do there. So there are schemes that exist. There are organisations that are out there who will talk to people about how you can shift to healthier choices. We also know that this is predominantly about reducing the amount of fast food available, but it doesn't also have to be that. It's also thinking about the meal deal. The meal deal is hugely calorific. It's incredibly good value, and I know why people buy it. Of course they do, because it's affordable and it's convenient. But how do you think about something that's a slightly healthier version of that? If you've got something that's got high levels of sugar, fat in it, it isn't just about demonising takeaways and food outlets. It's also saying, well, what's the retail offer here as well? What's the what's available for people to go and buy? One thing I would also say is lots of people who spend money buying food on your high street are people who work there. So how do you work with businesses to also think about what provision they provide to their staff, what kind of foods are available within the workplace? Because it isn't just about the retail offer on the high street. It's also about there's a huge number of businesses who could do way more to keep the healthiness of their staff going. And to be clear, if you invest in the health of your staff, you see fewer sick days, you see less turnover, you see less other issues in your organisation, higher rates of productivity by having a healthier workplace. Some of that's about food, some of that's working conditions, some of that's about occupational health availability. But actually, it's more than just saying, let's tackle fast food. And I think sometimes people think that's the answer to a healthy high street. Actually, there's a whole panoply of provision there. And back to public buildings, what are councils doing for their very own staff? What are the NHS doing? The biggest employer in the UK is the NHS. What's it doing to ensure it's got really healthy food options available, not just for the people working night shifts, but the people... And again, when we think about the community diagnostic centres, they're great for increasing footfall. Why aren't we also then encouraging something that creates a great food offer next door to it, so the people going into it can also get something healthy and happy to eat, which will make them feel better at the end of the day? So for me, there's more than just the regulation. definitely do the regulation, but let's start talking about the positive stuff you can do about really improving the overall food offer in that space, because it's much easier to make what you've got better than stop bad things happening, because that's when you then end up trying to do interventional stuff. And people don't like interventions, being blunt. They just don't like it.
That's really encouraging, because I kind of get the feeling that, you know, a kind of harsh regulatory environment, very sort of hectoring, nannying, telling people what they can't do, but actually to try and understand more about what can be done, and I guess using that more kind of influential sort of soft power, if you like, rather than a kind of harsh, you must not do this, you must do that. How do we kind of publicise examples of where that's happened, so we can show a model that can perhaps be rolled out more widely?
So this is where I think there is a big opportunity for Mayor to really showcase the best of London, and to do that in a way that picks up the difference between the inner and outer London boroughs. There's some brilliant work going on all over London that could be showcased. And as I said, if you're in a town that has a unitary authority and that's the only council, you've only got your own examples to work with, right? And I do realise the inter-council rivalry that exists, but actually it's not about doing what they've done, it's about taking inspiration from what they've done and using the principles to make it work for you. I also think this is where you could really use the public really positively. The public don't want more of rubbish on their high street. They're really clear on that. And what's interesting is if you go to more affluent areas, the public are great at starting petitions against bringing in chains and bringing in things that actually acts as real pressure locally to stop that happening. We don't empower our less empowered communities to the same extent. And so the question, I think, is how do you go back to local people and say, what is it you want? Because this is where you could start to have some really interesting conversations about the provision that is available on your high street. And actually, the really good points made about how you get to that very small row of shops. Make it super local, because then the locals will use it because they don't have to drive to get there. But they're only going to use it if it's useful, right? Somebody once said to me, things are only good if they're usable, useful and used. And we keep forgetting that when we make provision. We don't look to say, is this actually useful to the local community? Is it usable for them? And is it actually used? And we keep putting stuff into places that people don't want, and then a surprise when they don't use it. And I think there's something about how do we think about the public and their voice in saying what they want their high street to look like is really powerful in this situation.
Similar theme then, but wondering perhaps, Rob, if you've got some thoughts on how bids can approach that.
Yeah, absolutely. And again, this is what about sort of like thinking about each actor within their remit, and then thinking about where they can stretch rather than sort of taking on responsibility for, the curation of the exact shops on a local high street is not the role of the bids. They are a membership organisation, and there is always that tension to be managed between kind of like their roles they can play and kind of trying to encourage their membership to up their game, rather than necessarily sort of like you will do A, B, and C. So it's about caveating with is like it is one of those factors where we thought there was a bit of a less of a direct line between what the bid itself can do and the health outcome. However, we thought and worked with Team London Bridge around just some of the promotional and kind of campaigning activities around promoting awareness of healthy eating options, and thinking about how that kind of classic function of a bid as a placemaker of being like, how do you really broadcast where the really good options are? And how do you do? They do a lot of local comms, a lot of engagement, really sort of sending that message that there is good food on offer and it is a really, really positive thing to do. Again, in that, the carrot, not the stick. And then also, many bids, TLB being one, also sort of use some of their levy funds to kind of direct resource through grant making, whether you're supporting local organisations tackling food poverty, community pantries, those kinds of options, using some of the space that they have available. So Team London Bridge have their Hive space, and looking into options about like, could you offer kind of like low cost or free kind of community pantry style offerings. And again, we talked about kind of the more innovative stuff, like the fact they do have this deal card in the case of Team London Bridge. So, that is about like sort of crowdsourcing in where are all the discounts going on in the local retail offer, and then going, well, maybe if we look to really sort of promote the ones which are for the healthier options. And then the other one is, again, it's that role of the placemaker is in bids, because they can, sort of set stuff up on the high street. That promotional stuff is really, really important, that wider health engagement. So this isn't on the health piece, but in terms of interacting with local health services, for example, some of the place-based initiative, just advertising it. getting it out to the membership and saying, like, you can get a blood pressure screening round the corner today, by the way, for the kinds of things that you probably wouldn't have known about necessarily if you're just going to work, going to the office. So lots and lots of routes, and it's about sort of being like sort of imaginative, and a lot of these things are relatively low cost as well.
Well, I'm glad you mentioned cost there, because my final question was going to be around, whatever we want to do, it needs to be economically viable, because people aren't going to run businesses that run at a loss continuously. So is there something, why have we found in some places that things like fast food takeaways have managed to be viable, but other things are struggling, and what can we do to try and redress that balance to make sure that a broader choice can be viable, as well as if people want it, then hopefully they'll use it, but how do we make it so that they're willing to pay for it, if you like, as well?
Yeah, I think I'd defer to William on sort of the underlying kind of economics of why we have kind of more or less healthy high streets, but sort of going back to the kind of the role of the business improvement districts, they are reliant on that levy funding. So like a thriving high street is much easier to be able to do these things with. So there is a virtuous circle here. And also one of the things we bring out in our research is that, the economic determinants of health are enormous. The quality of your job, the level of your income, even inequalities within spaces have been related to different, like the actual inequality effect itself can influence health outcomes. So there is certainly something about the fundamentals of a local economy and its local health, which will determine the level to which even a well-meaning, say, business improvement district is able to influence outcomes. So that is where, this both comes to the local authority, but, strategic authority like the GLA in terms of thinking about how you grow the whole economy positively and create dynamic business activity. And then you can start the curation process. But, those economic fundamentals need to be really, really strong in order to start producing some of those virtuous loops when we're talking about the kinds of, to be totally honest, quite lighter touch, at the lighter touch end of things that, say, a business improvement district can do to maximise the positive impacts.
It's really expensive to be healthy, and it's really expensive to eat well. And it's no wonder that people want to eat a 99p chicken meal, because it tastes quite nice, it fills you up, and it makes you feel all right for the time you have it. And it's not their fault. And the challenge is we demonise that. If you want to get the same calorific availability as you get for a donut, which you can buy for £5 for a pound in a supermarket, you'd need to buy something like 3 kilos of carrots. You're not going to eat 3 kilos of carrots to get the same calorific availability. It is beyond the GLA, I think, to change the food system in this country. It's not beyond the government. The government needs to do much more to change our food system. That is a huge challenge to the UK, and we need to do something about that. If you want people to be healthy, you have to make healthy choices easy choices. We make it really hard to be healthy, and I would urge any council, any NHS organisation to make the easy choices as simple as possible for people to do, and then they'll do it. But it's also not true that you can't make healthy food more affordable. For example, the price of meat right now means that substituting lentils for meat, not entirely but partially, can massively reduce the cost, increase the fibre, and increase the healthiness of that and the calorific value for that meal for that individual. So actually, there are things you can start to do. In Denmark, they use public procurement differently. So they use, in their procurement tender, you have to be able to show a greater number of vegetables are used in every meal provided in public schools. What that drove was two things. Firstly, greater use of local services, and secondly, it actually got a greater level of competition because you didn't just get people who were producing homogenised food coming into it. So there are levers you can use. You could use tax incentives, for example, business rate breaks for people who provide healthy food. Those are things you could do. And I guess my challenge back to yourselves is to think about what are all the different levers you have, and if you pull all those levers in the same direction, what might be the benefit be? But let's be clear, for the average Londoner who hasn't got a lot of money, telling them off for eating a chicken meal isn't the right thing for us to do, and it's what organisations like mine get wrong all the time. What we need to do is make it much easier for them to get great, healthy food that tastes brilliant, that makes them feel brilliant and keeps them well and healthy and happy. That's our challenge. Their challenge is then to stick it in their mouth, right? But actually, we shouldn't be demonising the fact that people will buy chicken, because frankly, it's a lot cheaper to buy chicken than pretty much anything else on the market right now.
Very much, I'd agree. I'd definitely rather try and make it easier to create incentives for doing better things rather than hectoring and nannying and punishing people for making what are perfectly understandable choices in the context they're in. Thank you.
Thank you. Dr.
I just wanted to come back, and absolutely, just on the point of kind of making food more accessible and actually changing the narrative, because it's not even just a matter of affordability, it's also a matter of headspace and capacity, because not only do you have to buy the carrots, you have to cook them, you have to prepare them, and if you're doing 2 jobs and, you know, all kinds of stuff and you can't afford, and you're thinking about keeping the roof over your head, the last thing you want to do is chop the carrots. So there's a couple of things that I just wanted to talk about that have come up quite recently in some of the conversations we've been having. One of them is obviously going back to the neighbourhood health centres. There are a few centres that have started to develop or have developed before the terminology neighbourhood health centres existed, and that most of them do have community cafes on site that use kind of locally grown produce, etc., to create healthy, affordable meals for people that are attending, and for the staff as well. So you're absolutely right. The staff well-being, they are the community as well. The other thing, though, is quite interesting. We had a lifestyle medicine conversation, again, as part of the wider neighbourhood conversation. And in parts of other parts of Europe, they have these, what they call public restaurants, where actually food is cooked. There's no kind of stigma or anything around them. They're not, oh, you know, if you can't afford food, you go here. Actually, it's for everybody, and it's a publicly accessible place, and the food is healthy and it's balanced, and it's cooked locally with fresh produce. And actually, there is a conversation happening and a movement happening to say, actually, do we make those kinds of places more available, so that if people either can't afford to get good healthy food, or can't afford to, or don't have the capacity to prepare that healthy food, actually they can access that. So again, those are some of the creative things that, you know, again, we can take ideas from all over the place, but those are some things that we could probably probably consider developing in our local communities and again close to our high streets.
Thank you. I just want to quickly ask William a quick question about something I mentioned earlier in the meeting, the healthy catering commitment. Is it something that you've come across before?
Yeah, and again, it's how do you incentivise people to do these things? You've got to make it really easy and beneficial for businesses to want to do that, because it's pretty hard running a business right now. You know, I run a charity. It's hard to run a charity. There's a lot of regulation. You've got to make your money. So you have to make it as easy as possible for them to do it. And again, when we're thinking about schemes like that, what's the incentive to do it other than just you're going to be a good human being as a result of doing it? Because when times get tough, the stuff that you're doing because you think it's the right thing to do is often the first thing to go. And so there's a big call, for example, at the moment to reduce the VAT on restaurants in the UK. I think that's a really, really positive thing to look at that as a tool, but then use that as a lever to also say, and we'll particularly do that for places that offer healthier options or offer something above and beyond the norm. Don't lose the opportunity to use your levers. And so my question back to people who are doing that is, how do we incentivise it more to do that? Because unless it's helping you in what is a pretty tough time as a business right now, irrespective of whether you're public sector or private sector, often money is going to talk. So it's that thing of what do we do to support people to ensure that this doesn't make it harder for you to run the business. And so we've got to make healthy choices super easy for businesses, for individuals and for government.
So just going a bit further then, so for schemes such as that are accredited, would you support the concept of maybe applying a business rate discount for businesses that choose to sign up or offer healthy options on the menu, in addition to just maybe going back to the conversation on toilets, business premises who have toilets that might want to or be able to open it up, giving them discounts on business rates, for example? Is that an approach that you'd support?
Absolutely. If you want somebody to do something that's going to help and create health in your area, that's also going to bring economic growth into your area, make it as easy as possible for them to do it. Why would we make it harder to do the good thing than do the bad thing? And the difficulty with the bad thing is it's often easiest to do the bad thing.
Thank you. Assemblymember Boff, you want to quickly come in on this point?
Yes, Mr Roberts, you said that the Mayor had no power over the food system, and to an extent that's true. However, he's continually refused to sign the plant-based treaty, which is not about telling people what to do, but about ensuring that there are healthy options for people. Do you think perhaps he should sign the plant-based treaty, as so many other cities in the world have?
So I think you've got options to think about how you use your soft power. And I think what's really interesting is that almost always people who have soft power don't realise how much soft power they have until they don't have it. And I think it's interesting to, you can create conditions and you can make weather. And I think the choices you make, people see the things you choose to do and the things you choose not to do, and they take that as signals as to where you are. I think that's the Mayor's decision. I'm not an elected official. I've chosen not to be an elected official for lots of good reasons. But, for those who are, you've chosen that for a reason, and therefore you have choices in that. And you have both a role to your constituents and you have a role to your organisation. I think you can choose how you want to signal things. What you do is what people see, and they then follow that. And you can make the weather, and it's up to you which weather you want to make. And if you want to be seen as doing certain things, people will follow. And I don't think that's understood entirely by people in positions of power until they don't have it, if I'm really honest. As somebody who has very little actual power, working for an organisation that's a charity, I wish I had half the powers to say something and then people would then just do it and follow. Because you could make a really big difference just through your words and how people then perceive your views.
Thank you very much. Thank you, Chair.
Thank you. Just to note, though, plant-based meal, as I can say, is not necessarily always a healthy meal. So let's only remember best. Yep.
Thank you. William, I just wanted to touch on advertisement on high streets and the role they play in health, especially around food. Have you done any work on that or have any comments?
We haven't specifically. Other organisations close to us have. Advertising clearly works, otherwise you wouldn't spend billions of pounds on it every year. We know that children particularly are more susceptible to advertising. We also know that if you choose to take away some of the opportunities to advertise for unhealthy things, people will make better choices. There are places where they have done this positively. We've also seen some really great campaigns where organisations have themselves used advertising as a way to fight back against unhealthy advertising. Again, TfL for a long while have had no kind of advertising of fast food and junk food on the underground. That's a good thing. It's a positive thing. I think if you're going to go for an approach to harm industries and advertising, you need to do it across the board. So you shouldn't be advertising alcohol, you shouldn't be advertising gambling, you shouldn't be advertising food, and you shouldn't be advertising smoking. Okay, and that's just a basic. And any company who tells you that there's no value to it and stopping advertising wouldn't make any difference, why are they spending so many pounds on it? That's just nonsense, isn't it? And so, again, I think there are ways that you can use advertising. I realise it has a revenue generation effect, but what do you want people to see your borough as when they come there? Do you want to see it as a big billboard for a fast food company or for a billboard for a gambling company, or do you want to see it as a great place you can come to live and thrive and have a great job and a great experience and use our local services? And we know that advertising works, otherwise nobody would spend billions and billions of pounds on it. So, I'd ban it personally, but again, like I said, I'm not the mayor.
Okay. No, I'm just intrigued because, and you mentioned TfL then, but the interesting thing is you say you don't want to go to somewhere, a high street, and have a big fast food chain plastered over. Well, anyone that rides the tube will tell you that the fast food is still plastered all over the TfL network, which is the joke of the whole thing. So I just found it interesting because it's been such a hot topic for us on the TfL ad ban. I was interested to see if you'd had any thoughts on high street.
So we managed this quite well with smoking. What we seem to do with other industries is go for partial approaches. And so, the latest set of food advertising stuff is interesting. It's going to allow you to advertise your brand, but not your product itself. And, well, most people know what the brand is, and the whole point is they want you to go to the brand. So it kind of misses the point, if I'm honest. But then, it's really easy for me to criticise it. I'm not a policymaker. I don't have to work with all the different trade-offs they have to. I think the point I would make here is what kind of world do you want your children to live in? Do you want them to live in a world where they are bombarded by information that tells them to eat unhealthy food, to consume alcohol, to smoke, to gamble, and all these other things? Or do you want to live in a world where kids can feel healthy and happy and can engage with the things they really care about in life. And I think the stronger you are in your bans, the more likely you are to get a positive outcome. The more watered down they are, the more compromised there are, the more loopholes they are, the more silly it becomes. And then that actually gives the critics of it a real ability to throw stones through the window and saying, well, it doesn't really work. Well, of course it doesn't, because it's not really a ban, is it? What it is a partial ban. And so you've got choices. As I say, that's an elected member's piece, not a piece for people like me to say. But, if I had powers to do that, I'd say, yeah, absolutely, ban those. And people say, well, the economic development piece, and where will that money get spent? Funnily enough, money gets spent on something else. It's just you're not spending it on the advertising. So maybe those companies would put it back into the salaries of their staff, or they would put it back into the local community in which they live, or they would put it back into parks and recreation. There's all sorts of stuff you could do with that money. But, I mean, that's a personal view, right? And there's many people who would not agree with me on that view. And the one thing I can say is I don't benefit from any advertising, so I don't have any reason to say anything but what I've said. Whereas most of the people who would say that's not true have some sort of commercial interest in that, and therefore probably would say that banning advertising is a bad thing.
Thanks. Councillor Sandy, if I could come back to you. You told us a little bit about how Bexley Council has become healthier earlier. Is there anything that you want to add to that on how you've made, in terms of food, how you've made food options healthier?
So what we've tried to do there is, as I mentioned earlier, is expand on the variety. So the static, the independent retailers or food chains that we've got, obviously they're there, they've signed their leases, they're there for however long. But I think what we've done very, very well, and something that we are extremely proud of, is the fact that with these night markets, street markets, all this kind of stuff, because it's all pedestrianised, the Broadway, a fair chunk of it, there's only a couple of ends of it where you can go around the roundabout or whatever. The rest of it is all pedestrianised, and where we've opened it up, and we have tried to keep the cost of the stalls and the pitches down to a bare minimum where we can. Because one of the issues we did have, and I know someone on the panel touched on licensing earlier, one of the issues we did have is because to operate a street market or something like that on a high street, you need to get a street licence. And there was all kinds of cost implications and everything, but now what we've managed to do with the bid with the Business Improvement District is almost give them, they give us a fee, and then they can do a certain number of events per year or per 6-month period or however it works. But that has given them a lot more freedom. So they can now open it up to say, right, we don't need to charge, I don't know, £100 a pitch. We can now charge £60 a pitch, which then means it opens it up to some of the independents, not necessarily the bigger chains, who have got these catering wagons and things. So it can be your more healthier options, your more local options. We try to make it a lot easier for them. But the biggest problem is always, like everything else, it's all to do with funding. And where we're not getting the funding that we need to keep the high street thriving all the time, it's only because we're sort of moving a bit from here to there and there to there that we can keep it going. But that's what we're doing, is we try to keep the cost down where we can.
And just finally, you mentioned earlier the effect of having a big Primark and a big B&M and that helping to the health of the high street and the economic turnover. Is there any downsides to trying to limit fast food retailers, especially you've spoken about a couple of times about Blue Water being so close by with almost every restaurant and fast food outlet you can think of. So is there any detriment or downside you have to manage in terms of trying to reduce the number of those outlets on the high street?
Yeah, it's almost like a double-edged sword, really, because the problem is it's all very well having the big brands there. The problem you have is when the big brand, their head office base, wherever they are in the world, they have some change of policy and they're going to go from your high street. That's when you've got the problem, because then you've got a huge void on your high street. So that's what I mean, it's like a double-edged sword. It's great having them there and all the rest of it. It brings in the footfall and all the bits and pieces. But the day that they decide that they're going to pull out, you're then back to square one, because now what do we do with it? It's a huge outlet. What are we going to do? Split it up, etc., etc. But another thing that we've done recently, and certainly over the past couple of years, is where we've had empty units, and I can proudly say that I think we've got one of the lowest number of empty units, I believe, across London, or certainly we're up there in the top 5 or 10, I think. What we try and do is we'll bring something in like a temporary thing. As an example, at Christmas, we just bought a Christmas shop in one of it. I think it was a job centre or something like that, which had moved out. We bought a temporary outlet in there, seasonal for the time. So the occupancy, you haven't got a shop front which is boarded. It's still being used. And there's other projects now at the moment which the bid team I know are looking at, where we've got a couple of other empty units, bring people in there just to keep that not only to keep the occupancy, but keep the variety going. So it is kind of a chicken and egg scenario, to be honest with you, with the big food chains and big retailers.
Thank you. Assembly Member Boff.
Thank you. This is to everyone, really, is what further action would you like the Mayor of London to take to support healthy high streets in London, including the new London plan, which we'll know about in July? So who would like to start?
Thank you. I'd like to see fairer funding would be one of the key things that I would like to see, because I noticed there's talk in the papers of 12 boroughs getting £50,000 each, and actually that's the second point, but there was also a point on that same bit. It says where the Mayor of London, the 12 boroughs can use that £50,000 to develop a strategy of their own for their own local economy, alongside helping them to support their existing infrastructure, or auction them off. And that kind of got me. I'm like, so if we've got it here in black and white that the policy or the documents or the mayor's got the thought in his mind that he's going to ask retailers to auction off, not retailers as such, but high streets to auction off empty units because they can't make use of it, I wouldn't encourage that, because what we're trying to do is increase footfall, not necessarily encourage people to offload unused assets that they may well have sitting on a high street. So the funding is one thing, and then safety is the other, because that is a huge concern, certainly for us in Bexley, and I would imagine there's probably a fair number of other boroughs and all. And it's not just inner London, outer London. I think it's overall safety and security and policing does definitely need to be looked at. They're just 2 points. There's loads more I can go on about, but I think it's only fair if I give others a chance.
Has the London plan stopped you from doing anything?
It's, I wouldn't say it stopped us. It's made us sort of stop and, I suppose, take a seat back and sort of look at changing ways that we're going to be doing things in the future. And as I mentioned earlier, the policing, the security side was one of it. Was one of the points, and that's why we've had to incur the extra cost of £80,000 a year for an independent security company, and that's just one of the points that we've had to look at in recent months.
Dr. Naughtley-Meshe, what would...
Yeah, no, thank you. For one of the most important questions, I think for me, I think. As I said, we do have GLA membership on our board, but I think we probably haven't made the most of that and actually been a director or in terms of what we would need from the GLA and from the mayor. I think one of the key things is around endorsement of the London Neighbourhood programme and the way that we are choosing to work across organisational boundaries, and permission for the bits that aren't healthcare and the bits that that he has power and authority to influence, to be able to work in a different way and to think outside the box and do some of these creative things that we can do together. And some of that kind of links to your conversation about funding, because actually we may need to do things slightly differently in London while not breaching policy and national frameworks. We could have local workarounds or London workarounds that could work to allow us to be able to work more collaboratively. I think the other things in terms of the connections between health and the wider systems and the wider determinants, there's a big conversation around social legal welfare advice, the impact of financial status, eviction status, housing status, all those things on people's physical and mental health and well-being, their ability to afford their medications, their ability to engage with healthcare services, their stress levels that links to heart disease, and then going into things like food choices and then obesity, diabetes. It's all connected. And again, there's some work that we could do more collaboratively, and I think we need to have more direct conversations in terms of how we can work more closely with the GLA, but again, to have the Mayor's endorsement of those things. And then finally, the other thing is around personalised care roles. They have sat within healthcare. So we have a role that we describe as social prescribers, and they sit within the primary care network contract in the NHS. And they work for practices and PCNs. However, they are the link they're the trusted person for the patient, the individual, the resident, and the rest of the system, and they link into voluntary sector, they link into local authority and social care, and they're able to wrap around an individual. And actually, there is no reason why they need to sit in healthcare. There's a conversation that we could have around how we can have personalised care roles that sit across the system and support the residents to connect in with the services that they need. So again, that's another thing that I would be keen to explore further with the Mayor. Thank you.
When you say about working closely with the GLA, I mean, it sounds like you're calling for more analysis. Right?
I think,
whereas the analysis that health outcomes are linked to
yes. I don't think we need more analysis.
Are well established.
I agree. Sorry if I didn't make it. I think maybe the way I articulated it wasn't clear. What I would say is no, we don't need more analysis. I think we absolutely know the correlations. I think that it's about what we do about it, because we talk about it a lot, and the solutions unfortunately do not sit neatly within one sector, and that's the problem that we have always had, which is why we need to do this collaborative approach to solution forming. So the way we form the neighbourhood board is trying to tackle that. It's still early days, it's only been meeting for a few months, and we do have a GLA representative on it, but I think they're just a representative. I think there's something about actually, let's start talking about action, let's start talking about the things that we can do positively, and let's make public our commitment to making this work and actually trying to deal with some of those infrastructure changes, because some of them will be to do with estates, some of them will be to do with transport, some of them will be to do with air quality, some of them will be to do with, you know, that legal welfare advice, etc. We need to start building the solutions rather than continuing to interrogate the problem.
Thank you.
So yes, sorry, you're right.
Now, Mr. Anderson, Centre for London has always got an opinion on the London plan. What do you think should be in the new one? Or?
Actually, for this one, less on the London plan, because our research was so specifically focused on the role of the bids. And I basically would just point out the fact that London was the first place to get a bid in the UK. We've had them for 20 years. There are more than 70 of them now. The last sort of major piece of strategic research commissioned by the GLA asking the question of the role of bids in the capital is now more than a decade old. And they're doing quite a lot more than they were, than the old kind of, I think the phrase we used in the report was bins, branding and baskets. And, you know, what we think our research really highlights is that there are lots and lots of ways that bids can and already are influencing health outcomes. And as ever, at a very minimal level, the GLA and the Office of the Mayor, in terms of rolling as a convener, championing good practice, asking questions about how whole of London could go further, and how that could be a really positive route to kind of like the high street local business, and using those bids who are really, really deeply integrated, really understand the places. And then what can the Mayor be doing to be able to champion that work and make sure that goes further? And that should be a reciprocal relationship. And we think that that is, you know, a ripe space for policy thinking at the regional level, given there's not been a huge amount of thinking about it over the last 10 to 15 years.
And Mr. Roberts, the Mayor often says health in all policies. Well, if you were to have a look, you know, revise the London plan, what would you want to see in the new one?
I think all the things that the panellists have said so far, really don't lose any of those things. They're really important. And that is the reality of what health and policies is, I think. two things I would throw into that. I think one is paying real attention to this issue is really important because it's a wider metaphor for people's experiences of where they live. It's the visual representation of my place. Your high street epitomises the value placed upon you by the people in and around you. And therefore, whilst we might think about London as a tourist destination, we might think about central London and its role, we might think about the businesses that come into it, actually most Londoners live in a small town. There's just a large constellation of them. And so making those small towns brilliant places to live is absolutely your number one priority to making it a great city to visit, a great city to invest in, a great city to put your businesses in. The other thing I think that we haven't said today is the Mayor has particular powers around skills development. And I think to the point of, we talk about the wider workforce. It's great that there's people with public health in their job title. It's great there's people with health in their job title. The people who create health are people who don't have health in their job title. And how do we skill up those people? You know, in London, there's probably somewhere in the region of 500,000 people who could do more to promote health in their local area. They work in businesses, they work in statutory bodies, they work in charities, they work in the health service, but they also work, you know, in everyday parts of your town centre. And I wonder, how do you tap into those people? And the fact that Londoners want to be healthy, they love other Londoners, and they love where they live. And, you know, I lived in London for nearly 20 years. I came from a small town. I now live outside of London. All my friends from my small town, when they talk about London as a homogenous blob, anybody who's ever lived in London doesn't talk about London, they talk about their bit of London. And that's the power that the Mayor has that nobody else has, which is to really big up and enhance those small towns to be an economic powerhouse and a health powerhouse. And I think that's where I'd push GLA to go, because that's what the Mayor does that nobody else does.
Thank you. One of the things that's going to be in the London plan is about healthy zones. Do you have any evidence that takeaway exclusion zones actually reduce childhood obesity, or do they just mainly change the location of the outlets?
That's really complicated to answer. I'm conscious that I don't have nearly long enough to do it, and there's people who've written PhDs on that.
I tell you what,
the simple
we
answer,
are running late. We are running late. If you could write to us, I would really appreciate that to see the evidence that this works, because we've put them in, we feel they work, but we don't know they do.
They don't reduce childhood obesity because that's too complicated. What they do is they signal that you want to shift to a different environment, and it tells people that this is a healthy place you need to go to, which then creates the conditions for other health things to come in. That's really important. Don't lose them, but don't think they're going to suddenly solve childhood obesity in the UK, because that's not what they should be doing. They should be doing something else altogether.
Thank you, Chair.
Thank you, and we look forward to receiving that in writing. So can I thank all our guests for attending, and we'll now take a 5-minute adjournment before we welcome our second panel of guests. Thank you. Welcome back to the Health Committee, and a warm welcome to our second panel of guests joining us today to discuss healthy high streets. We have Louise Duggan, who is the Head of Regeneration and Growth Strategies at the GLA, Tim Rettler, who is the Area Manager for South Area under the same directorate, Gerard Burgess, who is a Senior Strategic Planner at the GLA, and Harry Birchall, who is the Planning Policy Team Leader at the London Borough of Brent. You're all welcome. So I'm going to ask the first question of this second panel, and we're going to turn to Louise and Tim for this one. So can you give us an overview of how mayoral funded programmes have sought to build healthier high streets in London?
Yes, thank you, Chair. I'm going to come in there, if you don't mind. I'll sort of open it out and set out our kind of thinking on this. But I think essentially for us, healthy high streets are not just about retail. They're fundamental to health, to economic opportunity, to social connection, and they require an integrated response that takes account of all of these dimensions. I think one of the core things that we're always very aware of, and it was mentioned just in the final comments in the previous session, is how much local high streets mean to Londoners. 92% of Londoners live within 15-minute walk of their high street, meaning they're hugely accessible, they support active travel, but they also support social connections. So something like 64% of essential services, so things including pharmacies, health services, etc., are on the high street. So they're local, they're accessible, and they're necessary, if you like. And that's why we've kind of continued to pay attention to them and to support them through funding across the last 15 years. There's a kind of economic health and a health link. It was mentioned again in the previous session, but you'll be aware of the link between vitality and health outcomes. And I guess it's important to note that our high streets, they're not the CAS, they're not the central activity zone, but they have a kind of a scale of their own. About 38% of jobs and 40% of businesses are on our high streets. So by improving our high streets, we have an opportunity also to improve those kind of economic outcomes and opportunities to access some of the good growth dimensions that can happen in London. Food and the environment, there's a huge role that they can play in access to healthy and affordable food. I think particularly through street markets. London street markets are a really important way that people that are at the sharp end of the cost of living crisis can access healthy, fresh food. And then there's also that kind of sense around that doesn't necessarily address the food systems, but there's something really important there about just affordable food and food that's relevant to different local communities. And our approach, as I said at the outset, is it's place-based, it's multidimensional, and we look at things like public realm improvements, we look at community and social infrastructure, and we also look at things like business support and local economic development. So it is really genuinely kind of understanding the multidimensional kind of potential of these places. Through programs like the Good Growth Fund and the Civic Partnership Programme, we've targeted investment in local high streets with particular needs to drive these outcomes. So, our funding skews to the places with greatest need. So I think the key point is the outcome of these programs is not just about better looking high streets, it's about healthier environments, stronger local economies and more resilient communities, particularly in places of greatest need. And I'm happy to kind of follow through with specific examples, but I thought I'd just kind of set out the kind of strategic context first. Thank you.
Yeah, great. Do you have anything more to add to that, Tim?
I mean, there's obviously lots of project examples that we could run through, and it was quite interesting to hear in the first panel that there was lots around the food dimension of the high street. And I think there's a number of projects that speak to that agenda in very different ways. For instance, we've done a project in Hammersmith and Fulham called Nourish Hub that was completed in 2022, just over £1 million invested from the Good Growth Fund, and that transformed 5 vacant units on the edge of an estate on a sort of facing onto a local shopping parade, and provided really vital services there for the community. So it's a community hub and kitchen that provides healthy hot meals and a Meals on Wheels service for elderly people in subsidized services. But importantly, it also has a training kitchen in the programming of that space. So there are training, volunteering opportunities for residents, and sort of looking at the sort of, I guess, the broad opportunity that the, sort of the food economy can bring to a local community. And social impact assessment of that hub has highlighted these sort of important impacts: improved access to food, the healthier diet, and increased social connection as well as a space where people can come together. And then there are other sort of services sort of built around that as well. So there's a citizens' advice offer around financial support. There's a local cycle repair workshop and drop-in housing support sessions as well. So you can really use that to build a broader social and community agenda as well. Louise mentioned markets. I mean, there's a couple of, or even more, market projects that we've been doing. One, which is very live at the moment, is in Croydon Town Centre, where we're investing just over £800,000 through the Civic Partnership Programme. And that's really to, I guess, build on the, I guess, on the history of the old Surrey Street Market on the edge of Old Town, and help to improve operational infrastructure, the accessibility to the market, improve seating, lighting, greening, make it a just more really nice social space. And importantly, that's a space that holds a function in terms of offering fresh vegetables at affordable prices for residents, but also for lots of the workers in the area as well. So it's a key project. It's a historic market, 750 years old, is really looking into the future, how we can sort of future-proof that. Bermondsey Blue Market, that's a project that we've done through the Good Growth Fund. And again, it's just not thinking about the market offer itself, but also, I guess, the social dimension of that space. So that's a project that we've already done in that space. I mean, there's lots of other projects I could run through, but if there's particular ones.
And it's just interesting on the Blue in Bermondsey that was very much initiated by a local community group and a bid. So, you know, again, those kind of multifaceted kind of partnerships that you can build up to realise the potential of these places.
Thank you. Actually, it's very helpful you gave those examples, because that was sort of my next set of questions, asking for those examples. Okay. So you've answered them. But actually, I'm fascinated by the examples that you've given. Actually, it'd be great. It'd be great if you could send us a list of some of those examples and projects that you've worked on. Maybe tell us, obviously, what's worked, but what's not worked. As well, to see if there's any improvements. Do you want to come in on that, Tim?
Yeah, what we're doing right now is the Good Growth Fund evaluation of the entire program of the 80 or so projects. So we've got external consultants looking at that and quite sort of critically as well. You know, the lessons learned, what went well, what maybe could be improved another time, and so forth. That's at a sort of draft stage, and we hope to publish that later in the year. So that would be, I guess, the ideal sort of set of information to really give the committee a comprehensive picture, but I'm happy to share individual projects in advance if that
would be helpful. Just very quickly, how do you choose the individual areas? Obviously, London's a very big place, 32 boroughs plus the City of London, but also many town centres within those boroughs. So how do you choose where you choose to spend your resources in terms of projects?
Well, every programme has its own kind of criteria, if you like, but increasingly what we've been doing is, you know, I said in my opening comments that we skew towards the places with greatest need. We also, you know, we don't want to ignore the places with greatest opportunity, because sometimes you can learn things from there that are transferable to the wider kind of system. But certainly since the Good Growth Fund, since the pandemic, we've been trying to use more of a data-informed way of targeting the kind of limited resources that we have to invest, and that in part is enabled by our High Street Data Service, and our High Street Data Service helps us to understand the kind of economic health of the High Street, if you like, and it can identify those places where there's greatest need and opportunity. So in some of our more recent funds like the CPP, we've been more targeted from the outset, so it hasn't been a 360-degree call. It's been a call out to places where we know that the conditions exist where we can do high-impact work.
Thank you. Assemblymember Boff.
Can I just ask how you're working with the boroughs once you've allocated the money?
I mean, we work in partnership with the boroughs. Some of our, the Good Growth Fund went out to community groups as well as directly to boroughs. So I think it's always been about the kind of engagement that is about delivery of a good project, but also about, supporting the capacity that exists in a local place, sometimes augmenting that, sometimes just with smaller organisations, helping them to develop their capacity and capability to deliver a kind of a capital project. But it's very much in partnership and, deferring to borough partners as the people that know the patch more intimately than we know it, and therefore are able to make connections to the relevant groups locally, and then build up a partnership that can actually get on with delivery.
Is that really what happens? Because do you regularly monitor those schemes that you invest in?
Yes, there's quarterly, I can go into all the details of the monitoring that we do, but the short answer is yes, there is regular monitoring, and that monitoring in part is linked to the payment of grant, and it's also what's going to inform the programme level evaluation. So it is something that we do, and we have people within the team who are kind of bringing complementary skills to ensure that kind of best value can be achieved in different projects. But it's a really broad range of projects, so I wouldn't say that...
Yes, the reason I raise this is because I'm most concerned about one particular scheme that you're running, which is on the Good Growth Fund, Queen's Crescent Market, where a considerable amount of money has been spent from the Good Growth Fund. Well, most of it seems to have gone on consultants and architects' fees and all the rest of it. And they're all happy, but the people who aren't happy are the people who use Queen's Crescent Market, who feel that they've not really been involved in the redevelopment of that market. And when I've chased the GLA before, I just get the impression they say, oh, that's the council's responsibility. Well, £6 million later, and people on the market really haven't got something that they wanted when they were first asked about it. So I'm wondering how regular that monitoring takes place.
Well, like I said, it is, it's quarterly monitoring that we have. So we do have all those sort of records and returns, if you like. But there are times when things don't go according to plan, and we do have to kind of face up to them and learn from them. I think in Queen's Crescent there have been a number of challenges. There have been kind of, I don't think it's fair to characterise it that nobody is happy with it, but I understand that...
I went down Queen's Crescent Market, I walked the length of it, and I stopped people and I said, isn't it great that that GLA is investing money, and not a single person, not a single trader really wanted the redevelopment to go ahead. And for people to turn down £6 million on their market is quite a thing.
And as part of our evaluation, we're definitely looking into that. So I think we're not trying to kind of shy away from learning those lessons, but I don't think it's as straightforward as you're characterising it, if I can just say. I'd love to be
introduced to somebody who actually thinks it's a good idea, who isn't either an architect, a consultant, or a local councillor, because certainly I couldn't find an ordinary member of the public at all. To what extent will the High Street Support Fund contribute towards building healthier high streets, do you think? And incidentally, before you answer, you did mention that there will be an appraisal of the High Street Support Fund. When will that happen?
So the High Street Support Fund that you refer to is £20 million UK SPF Communities Place capital funding that the GLA effectively set the investment framework for, but that's managed it centrally. But the projects are led borough by borough, as 26 of them. And we've got a team that does all the management of that, and that will include then the final evaluation as well. As you probably know, government has extended the UK SPF funding programme until September, and some of the boroughs have taken up that extension as well, so delivery is still ongoing. We know that we've got set targets around that, for instance, 24,000 square meters of public realm to be created or improved, alongside 4,000 square meters for commercial space and around 110 amenities facilities created and improved. And the delivery today sort of shows that we're sort of halfway there with the public realm improvements, but with these kind of schemes, you really get the outputs usually at the final end when construction is completed and it all is on track. And the outputs for the commercial space and amenities are sort of also on track.
So it's going to be after September, before we know.
Yeah. I mean, there are some boroughs like Camden, Ealing, Southwark, Wandsworth, Harrogate. They've completed their schemes already. Some others are still in delivery. Because these sort of packages are borough-led, some boroughs have chosen to allocate that funding to several high streets, several town centres, and that is absolutely fine. That makes sense. They know, I guess, where their local needs are. So it's, I guess, a slightly more dispersed approach than maybe we would have taken through something like the Civic Partnership Programme or the Good Growth Fund previously. But I think it's a good complementary offer.
And so what we know today, how has the High Street Support Fund contributed towards that aim of healthier high streets?
I guess as Louise tried to explain in her opening remarks, so we look at sort of the high street in a quite holistic way. For instance, public realm improvements can help people socialize better. They can help with the walking and cycling aspects of the place. If you then think about greening and planting of that can contribute to the air quality or I guess the generally sort of climate resilience as well of the place. So I think there's sort of several aspects that can contribute to a health dimension if you want.
I mean, I'm pleased you're looking at it holistically, because one of the things, if you take, for example, street markets, is that one of the things that traders need is somewhere to park. Because if you're selling stuff on a market, typically you wouldn't take it on a bus. You would want to park in the area. And I just wonder whether or not that ability to park for traders, let alone customers, who I also think you should have somewhere to park, but just for traders, is that something that you would look at and provide for?
Absolutely, and I think it was quite interesting in the first panel. There was a bit of a conversation around the quality of community engagement, and that one should not go in and just ask sort of quite predetermined sort of narrow set of questions around like what kind of parking or what kind of color do you like your shop fronts, but you really look at the broader constituency of the high street, and that includes obviously the traders in the shops, but also the street traders, and they have quite different requirements.
They
we know
sure
that.
do.
So when we talk about engagement, I think it's really the traders are part of the community as well. So and the servicing of street markets, we know that is quite vital, and how that can be managed in any sort of schemes that look to improve the road layout or whatever is absolutely vital.
And will we see a manifestation of that in your in the outcomes? Will we, on the monitoring, will we see that they have been? The reason I'm so interested in this, I used to help run Broadway Market years ago, and traders are difficult people, but they all have some common requirements in order to turn up and make that high street vibrant. So I'm looking forward to seeing some kind of within the monitoring report, some kind of evidence that those traders have been consulted and their interests have been taken into account.
I mean, if you look at Surrey Street Market in Croydon, for instance, was a project where we've been very involved with the council. I mean, the traders are really at the core, and the council officers who lead the delivery of the project, they're constantly on the ground, on the street, talking to the traders as well. So I think there is good evidence that is sort of baked into the project.
I should just amend what I said. I don't mean to say that traders are all difficult people, but sometimes they're put in situations where if their livelihood is threatened, it's in their best interest to be difficult. So I think
I was
that's
going to say
an important clarification. That
There's some of the
In a
most
good way.
entrepreneurial people, and markets are often the first places where first generation kind of immigrants can actually kind of begin to trade. So I think there is something I think brilliant about market traders and how they're willing to campaign and how passionate they are about their places. But I don't think it always has to be a them and us thing. There are really good stories about places like Surrey Street, but also the Blue in Bermondsey, which was, spearheaded by the fishmonger, who's no longer with us, but was a real kind of community, he in himself was a community institution, if you see what I mean. And he made sure that we, were kept honest in all of the decisions that we made and in all of the engagement that we did. And again, I'm sure when the Good Growth Fund evaluation comes out, you will see some of those stories emerge about where that has gone right, as well as some of the places where it's been more challenging.
Thank you very much. I could wax lyrical about market for hours, but I'm going to stop now in the interest of time. Thank you, Chair.
Thank you, Assemblymember Boff, for restricting yourself. So my next question is for Harry, so I'm going to bring you in. So what actions have Brent Council taken to ensure the borough's high streets support the health of local residents, and have any of these actions in particular been successful?
Well, thank you very much for the question and for the invitation as well. I think my first point is that I won't labour the point that's been made in the previous panel and this one about health being a holistic lens through which to view interventions, and that many of the actions that we take in the borough are either directly or indirectly related to health outcomes. And I suppose I could best split our actions into the facilitative, the preventative, and also I think we do a bit of advocacy as well around this. And the reason for making that distinction, in the previous panel, that we were talking about, or previous speakers were talking about the importance of not focusing simply on the regulatory at local authority to improve health outcomes on high streets. And so on the facilitative side, obviously we invest in the public realm. The public realm itself is connected to a sense of well-being. Particularly over the last year, there's been quite a bit of tree planting in high streets and in the borough as well, which obviously has impacts on well-being and air quality and that sort of thing. There's been initiatives, particularly through the recent heat waves, to create cool places for people to congregate. And more broadly, there are initiatives to support active travel. We're currently undergoing or developing a local cycling and walking strategy as well. And just making that link between economic prosperity and health. There is a broad programme of investment across our priority town centres. We're quite active in supporting business associations and trader groups. We put on community festivals, events, cultural programmes and that kind of thing, and that encourages people to come to the high street and reduce things like social isolation. And some examples of that, the Neasden Community Partnership Programme provides that kind of thing, and that's a good example of a programme that my colleagues in the town centre team have been running. We have a creative enterprise zone in Ealing Road in Alperton, and a program called Brent Works, which offers local employment support and other regeneration programs as well. A particular favourite of mine is a Buskers Corner programme. So we facilitate buskers in town centre as well, bringing people into the town centre. And of course, there's the partnership working with other institutions such as the police and business communities as well. So that's an example of, I suppose, the facilitative nature of what we do. But the reality is that there are serious issues with particularly the most deprived areas of the borough and town centres, and with agglomeration of, I think we have the highest concentration of, or second highest concentration of gambling and adult gaming centres in London. And so, there are real other measures that we have to take through the regulatory regimes to try and address this. So from a licensing perspective, there's work that my colleagues in licensing are doing to target or to address areas where we've found that there are high related alcohol harms. And that's to do with limiting opening hours of particular establishments where not just where it's just alcohol and not alcohol and food being sold. And there's quite a bit of work being done, at a detailed level on the PARN habit and the health issues associated with that. We obviously work closely with the police and other colleagues around drug use and hotspots in the high streets that are affected there. And just so on the advocacy point, I mentioned that obviously there is we have the second highest concentration of adult gaming centres and gambling centres. So we've been working with the Social Research Foundation to play our part in addressing some of the wider systemic issues about how the regulatory regimes might arguably be slightly too permissive in addressing agglomeration of uses that some may see as harmful to health in high streets.
Thank you. I'm just going to pause at that point and welcome the school council from Kenmore Park Junior School, based in Harrow. You're very welcome. I'll say that as a representative for Brent and Harrow. And we're discussing today how we can make our high streets healthier. So areas maybe close to your school like Kenton Road and Queensbury Circle, seeing how we can make them a lot more attractive and have more healthier things out there, and maybe less so of the unhealthy things on our high street. So you're very welcome. Just on that, Harry, so you've spoken obviously on what you're doing in terms of planning and licensing policy. Now, the first part, I don't know if you were in the audience and you listened to some of what was said by the experts in the first panel, but are you looking at how you can maybe incentivize and attract more businesses that provide healthy options or healthy outlets on high streets? So stick and carrot, a bit of both, or is that something you've explored?
Well, my caveat here is that my role within the spatial planning team is more on planning policy. I'm pretty sure that my colleagues in the town centre team have indeed done just that. But I think what the best thing for me to do is to get some more concrete examples for you and share with the panel, because yes, I don't want to tell you details of things that I'm not fully aware of, but I know that there are broad programmes around that kind of thing, if that's okay as an answer for now.
Yeah. We're happy to receive that in writing.
If you don't mind me just chipping in there, because I know coming straight out of the lockdown, there was an initiative where we collaborated with Brent and funded some work with the SAFI, which is the Somali Action Centre, which is looking very much at a local high street and how you can get different kind of positive activity in there that is linked to employability, to healthy food, but also to community integration. And that's particularly interesting because that was one of the places that had the highest mortality rate in the UK from COVID. So there are definitely very good things happening in Brent on high streets around that. But I mean, that's because I interact with that part of the world more than maybe the policy world.
And it's very welcome.
Yeah. Thank you. And Harry, just on the impact of the limiting of the use of town centre spaces for oversaturated retail, so, takeaways, betting shops and vaping shops and gaming centres and gambling outlets, what have the challenges been? So you've mentioned or spoken quite a lot about the gambling industry and betting shops in terms of licensing, but what about maybe more on sort of takeaways?
Yeah, I won't go too much into the weeds of the policies, but just to say, obviously, we have 2 policies in our local plan, which are aligned to the London Plan policy, things like E9 about saturation of uses. And the way we approach things like adult gaming centres, betting shops and takeaways is that we take a quantitative look on each planning application and relate it to the percentage of a frontage on a high street that's taken up by, by such a use. Now, that in itself can get quite complicated and detailed on an application by application basis. And I suppose the challenge is it opens up an interesting discussion about the general, I suppose, permissive nature, contrary to popular belief. Everyone thinks that planning is, a blocker, right? But it's not. And in fact, this is quite a good example of where having a sort of permissive regime through the NPPF, National Planning Policy Framework, which has a presumption in favour of development, makes us, even if we have restrictive policies, to make sure that we're considering all material considerations in the round, which a lot of the time can actually move things in a more permissive direction. Broadly, obviously, that's not a bad thing, but when you're talking about the complicated nature of trying to restrict land uses, through policy, it does open up some difficult questions. And I don't want to be held to any figures here, but I did do a broad brush, quick look on our system about how many applications we've been, looking at and approving and refusing. Now, since 2022, when these policies were introduced, I've found that we had about 12 applications for adult gaming centres across the borough. About 50% of those were refused, and about a third again were allowed on appeal. So I can't say that all the reasoning for that was around the considerations of health impacts on town centres, but the point is that the regulatory regime alone is not enough to be able to tackle the big issues that we're trying to face. We're trying to deal with. So that's on the planning side. Of course, on the licensing side, there is this broad aim to permit, or on most licensing applications and within the regulatory regime, and that's one of the things that the research that we had done with the Social Research Foundation has aimed to tackle, really, and looking at the unintended consequences, I suppose, of that aim to permit regime, and the exacerbation of less than uses that are linked to poorer health outcomes in our high streets.
Thank you. We're going to bring in Assembly Member Russell.
Thank you, Chair, and good morning, everyone. So my questions are for Gerard and Louise. First of all, just wanting your sense of what the 2021 London Plan has done to make London's high streets healthier. Gerard, I don't know if you want to kick off.
Thank you, Assembly Member, and good afternoon, everybody. So we've been looking at the various impacts of Policy SD6, which is the London Plan policy on town centres and high streets in the 2021 London Plan. You may recall it was first published in draft in 2017. So I'm going to provide you with a few high-level provisional findings on on the impacts of this particular policy. And they may not necessarily reflect the circumstances of every town centre.
Sure.
So they're general, broad pictures we're seeing across town centres and high streets as a whole. So the first thing we're seeing is that, supported by the London Plan policy, we're seeing that London's town centres are evolving and diversifying. And they're diversifying particularly towards leisure and nighttime uses, and towards convenience retail, and slightly away from more traditional comparison goods retail, where you have a choice between different goods. And so we're also seeing indoor leisure floor space experience particularly strong growth over the period 2017 to 2024. And as I mentioned, nighttime
When you
use...
say indoor leisure, do you mean like...
So it could be things like gyms, leisure
okay,
centres, those sorts of uses, but it covers a broad spectrum. And as I say, nighttime floor space increased over the period, including pubs and bars, of which a proportion does have expanded food provision, but other uses with a less direct focus on alcohol consumption, including cinemas, increased strongly, theatres, particularly in the central zone, restaurants and cafes also experienced quite strong growth. And we also noticed, according to the data from the local data company, is that health-related uses, that's including things like GPs, dentists, health centres and health clinics, increased by over 30% over the period 2017 to 2024, but note that they just account for just less than 1% of total town centre floor space. So it's growing, but from a small base, but there is definitely some evidence we're seeing of growth. With regard to betting shop floor space, and this is an interesting one, now we're actually seeing that they are declining on average across all town centre classification types over that period, but they still account for a relatively high proportion of total units in some town centres. So it's not saying that that issue is a declining one. It's still a big issue for some town centres, and also it doesn't reflect the particular concentrations in particular parts of town centres as well. But we're also seeing more applications for adult gaming centres as opposed to traditional betting shops. So that's quite an interesting trend, which we're also picking up on as well. And we have some development data, which, Chair, if you're happy, I share with the Committee Secretariat after the meeting. We just need to do a few validation checks, which I'm sure the committee members will be interested to receive. I'll leave it there. I can come on to hot food takeaways shortly, but I'll leave it there.
I've got a few questions. I want to sort of come back on this because, interestingly, you mentioned policy SD6, and I just reminded myself what's in policy SD6, and what's really interesting is that there's no kind of it's about sort of healthy travel, but there's nothing about actual health provision in SD6. And what we were hearing in the first panel this morning was about use of spaces on high streets for public health purposes. So, for instance, health visitors, getting people minibused, instead of health visitors going individually and seeing people in isolation we've given the example of to change leg dressings, people were being taken to a hub at the on the high street, and it became more of a social interaction. So yes, everyone got their legs dressed, but they also played a bit of bingo, had a cup of tea and a biscuit, and actually had some social interaction, which kind of sounded, as it came across to us, as a rather sensible way of using space on the high street, and B, of kind of making sure that the health street is genuinely a healthy place, somewhere where people are expecting to encounter that support for their health and well-being. So, are you beginning to think, as the new London plan is being developed, that public health might be playing more of a part in the kind of proposals for high streets across our city?
Thank you for the question. Obviously, at this stage, I'm not able to comment specifically what is in the new London plan. We will, of course, have the conversation about that at the appropriate time when we launch in hopefully in July is our intention. But certainly the current London plan has a very supportive approach to exactly the sort of diversification and adaptation which you're referring to. It has a supportive approach to this adaptation. And of course, since the London plan was published, the planning use classes, as they are referred to, were amended in 2020 to introduce a new planning use class, which is referred to as Class E, which covers commercial, business and service uses. Now, health-related uses are one of the components of Class E. So, in effect, that change which happened at the national level has, in a way, supported that facilitation of the adaptation of what could be currently a retail unit. It could be a vacant, any kind of vacant retail or high street use could become a health-related facility without the need for planning permission. But of course, the use class works both ways. So an existing health facility could also be vulnerable to change to another use within that planning use class without the need for planning permission. So there is a little bit of kind of double side to the changes to the use classes order. But we hope that the current London plan has been helping to support that, very much that kind of diversification which you referred to.
Okay, well, I'm sure we'll all be talking about that more as the new plan, as the new draft plan comes out. Going on to policy E9, which you mentioned in passing, on restricting the growth of hot food takeaways, and have you got any observations on the impact of policy E9 on making our high streets healthier?
Thank you. Yes, we've been looking at that as part of our London plan evidence, just looking again at very general trends in hot food takeaway floor space across London's town centres. Our provisional findings suggest that it has increased strongly by in excess of over 100,000 square metres over the period 2017 to 2024. That's a 38% increase in the floor space associated with that use, according to data from the local data company. Now, growth was particularly strong in the larger town centres, so places like the international centres, like the West End, and also the larger metropolitan centres, which experienced the highest levels of growth, compared to the smaller district centres, which typically saw lower levels of growth, but still an increase. But again, that's a broad picture across all the centres.
Is that a sort of post-pandemic thing?
So our data, we can break it down between the financial years, and we can show that, but the data I have at the moment is just for that whole period. But in the London Plan evidence, which we intend to publish alongside the plan in July, we'll have some evidence showing the time series of that as well. And we also have some very interesting development data, which my colleagues in the GLA planning data team have provided. And again, Chair, I'll be happy to share this with the Secretariat after, again, for the Assembly members to review. And that showed that there were, over that period, 2017 to 2024, there were 627 planning applications with either a net gain or loss of hot food takeaway uses. Now, 488 of those were for net gains of hot food takeaway. That's 78% of those applications. And of these, 243 were approved. That's 50% of those applications. 164 were refused. That's 34%. And 81 had an other planning status. That could be it's not determined, or it's still a live application, or whatever it might be. Now, that's interesting because over the same period, government data suggests that around 80% of planning applications in London were approved. So the approval rate for hot food takeaway uses is significantly lower than the average across all types of planning applications in London.
And do you think that's because of people taking a public health approach in their decision-making?
That's the next step in the analysis, because at the moment we don't know what the reasons for refusals were for those. Now, it may be through our planning data, we may be able to access reasons for refusals, and if we're able to do that, we may be able to do an assessment of that. But that's subject to the data. But there's just an interesting initial findings, but obviously there's much more to delve into.
Yep. So the yes, what are there any things that you're particularly concerned about as sort of limitations coming through from the measures in the 2021 London plan? And could the new London plan, do you think, do more to influence the composition of high streets? And Gerard, I'll come to you, but then also to you, Louise.
Thank you. Yes. So, I mean, we talked in the earlier session this morning about a range of limitations to policy approaches around building healthy high streets. I think we talked earlier about wider economic factors, impact on vacancy, which again has a very big impact on the health of high streets as places, but also on the health and well-being of Londoners accessing those high streets. We've seen changes in consumer behaviour, so we've still got the continued rise of online shopping. So again, that has an impact on our high streets in the sense that some of that spend that would otherwise have been spent on shopping is being spent online. However, we are seeing from some of our work on the High Streets Data Service that spend on other types of uses, leisure, experiential service type uses, is holding well. So there is some evidence that change in consumer behaviour is having some negative impacts on the retail side, but some positive impacts potentially on the leisure side. The other limitation is, of course, that planning permissions only relate to new development or changes of use, and what they can't do is retrospectively affect or impact existing uses that are already there. So that's one limitation to be aware of with the London Plan and planning policy generally, is that it can only apply to new development or changes of use or enforcement of conditions of existing uses. And then on gambling specifically, we engaged with health colleagues on this, and of course London Plan and local plans set the framework for planning decisions, but the key levers, things like advertising regulation, licensing, are nationally controlled, and so that has an impact on the degree to which the London Plan can influence. It can play a role and a part, but it can be limited. And finally, appeal decisions as well. So sometimes local authorities using their local plan policy, we heard Harry mentioned before, using the London Plan policy, using the local planning policies, but then the appellant going to appeal, and sometimes inspectors are overturning the local authority decisions for various reasons.
Okay, thank you. That's really helpful. Louise, did you want to come in on this?
Yeah, it's a kind of a complementary analysis because, like, Gerard and Harry are both very much involved in the system and the planning kind of, and then the work that my team does is very much about kind of understanding that policy ambition and trying to lift it from the page and trying to kind of apply it and do demonstrator projects in particular places. So my stuff is always slightly anecdotal, but we try to, through our kind of programme evaluations, we try to kind of scale up and learn from places in a way that can help to inform the policy development cycle, right? And we work very closely with Gerard and others in helping to feed into that. And one of the points Gerard just made, which was interesting, is this whole thing about the death of the high street being kind of like very, very actively reported and slightly overstated, you know, in taking a kind of a non-sector point of view and just looking at in-person kind of purchasing, despite the growth of online retail, a growing proportion of spend is happening in person on London's high streets. And Gerard has broken that down, lifted the lid on that and said, you know, a lot of that is gyms, it's people eating out more, etc., etc. But it's just one of those things that kind of goes counter to those national headlines that you see about the death of the high street all the time that I think is interesting. And you were asking, what can we do? What can we do about that? And I guess the programs, the investment programs and the support programs that my team helps to deliver are very much about how do you do demonstrator case projects where learnings can be taken from. So there's that's supported through the direct investment across all the different programs that we've funded over the last 10 years or so. But we also do things like helping to support capacity and capability. So there are things that we run like a high street network, and this is bringing together practitioners from local authorities from across policy areas, including health, including culture, including economic development, and sharing best practice. So understanding and, you know, trying as the GLA to be doing it, in a collegiate way, the agendas for those things and the programmes for those sessions are very much driven by what boroughs and partners want. And one of the things that's come up in the last 18 months or 2 years is the high street rental auctions, for example. So I don't know how familiar how familiar people are with the high street rental auctions, but that's a new provision that came in under the last government, which is about persistently vacant properties on high streets that are having a negative impact on local high streets. And it's the ability for local authorities to use it almost as both a carrot and a stick, and to kind of say, we now have this power, we could choose to do this, or you could choose to actually kind of let your, get this back into active use on the high street. So it's not necessarily about trying to kind of always take control. It's a carrot and stick dimension. But what we've been doing is working with 4 or 5 boroughs who are interested in using those powers. We've been kind of doing some of the research, the understanding of what these powers might be and what the implications, getting ready to potentially use those skills. And that means there's a test bed, if you like, and there's some exemplar case studies that could come out of that process that then other local authorities can learn from, because it's a new set of powers. They're not well understood. There's no history of them in London. So what can we do there? So I think it's just important to be, you've got the London Plan setting policy frameworks and ambition. You've got us doing capital projects and local strategies, but also looking at some of these system things where we can work with boroughs to optimise outcomes for Londoners on our local high streets.
Mm-hmm. Thank you.
And again, this is something that's very live at the moment, but I would be happy to provide additional detail on that if the committee is interested.
I think that would be really, really, really helpful. So my final question is about how the London Plan team is working with colleagues in public health to ensure that health issues are considered as part of the London Plan. I don't know who's best to go for that first.
I'll take that. Thank you. Thank you for the question. To report back, on the 13th of May, the Deputy Mayor for Planning, Regen and Skills, Jules Pipe, and members of the London Plan team met with the public health team, together with Kevin Fenton, the Statutory Health Advisor to the Mayor, and Tom Coffey, Health Advisor to the Mayor. So there's been that engagement at the Deputy Mayor and London Plan level with the Mayor's advisors. And there's also been regular collaboration between the London Plan team and the Public Health Unit at officer level, both during the preparation period of the new draft London Plan, seeking to reflect those key health considerations, and also in the final stages of the preparation of the draft plan, and in particular in relation to the integrated impact assessment and its consideration of the likely health impacts of the emerging draft policies. So we've sought to engage the public health team at various levels throughout that process.
So that's really good to hear. One of the things that Assembly members hear all the time on other committees, whether it's housing or whether it's transport, is the importance of co-production with deaf and disabled people's organisations, so that rather than people kind of having to say after things have happened, actually this doesn't work for us, it's not accessible, that it can be, that it's baked in from the very beginning. So are you, has there been any sort of thought about engaging with deaf and disabled people's organisations at this kind of early stage to make sure that the draft London Plan is really thinking about how things can be co-produced so that you've got those voices really calling for accessibility and an understanding of the accessibility needs of Londoners sort of baked into the draft plan?
So going back to the Planning for London programme, which was launched a number of years back, sort of after the pandemic, we sought to engage a range of different groups and Londoners specifically across a broad spectrum of Londoners to get their views on planning policy going forward. And then as part of the Towards a New London Plan programme as well, this was the Mayor's kind of preparation document, if you like, before the London plan. Again, we sought to engage with a range of groups, including inclusion and access groups as part of that. So whether it's at the same degree of kind of co-creation of actually drafting policies, it was more around a dialogue of what the key issues were and what those respondents' thoughts and feedback was on the general policy approach, rather than a direct collaboration on the drafting of the actual policy wording, if that's helpful.
Yeah, I think one of the things that groups like Inclusion London would say is there's a real need to have someone with lived experience of disability who is kind of engaged in that sort of assessment of what's in the plan. But so I think that's just the bit that is really important as this plan comes through the sort of processes, that those voices of disabled and also older Londoners are really heard loud and clear at an early enough stage to be able to really influence what the eventual plan actually says, so that their voices are really incorporated into the documents that govern how planning decisions are made. Does anyone else want to come in on that, or otherwise I'll hand back to the chair?
There's also been other various workshops that have been going along during the London Plan period. Like there was a workshop around designing for disabled experience, which we attended, and so we were plugged into other forums and groups as well as part of the process. And it's something that we will commit to do through the next engagement period through the consultation.
Thank you.
And if I just add, there's just those experiences that we have in places like LLDC and their accessibility panel, and that is something that's definitely being looked at in terms of how we make sure that in a more kind of like ongoing way, we have access to that lived experience to make sure that it is influencing and informing all of our work.
Thank you. Thank you, Chair.
Thank you. Assemblymember Boff, you've got a follow-up question?
I mean, very quickly follow up what Assemblymember Russell was saying, because when I talked to Inclusion London only last week, they weren't that convinced that they had been consulted as a part of the plan process. So that might be worth you chasing that up. The question I have, I've got loads of questions, but we're right at the end of the meeting. The question I have, will you do an evaluation on the effects of the current plan's parking restrictions on outer London high streets?
So I think that is a question for Transport for London. I can liaise with Transport for London colleagues on that.
Well, it's the economic effect on those high streets.
It is, but we would need to do anything in collaboration with Transport for London on that. So I'm not aware of anything at this present time. But it is something that, if it is something that the Health Committee would wish us to look into, I would need to liaise with Transport for London to take that forward.
I certainly would welcome that. If we're talking about treating markets holistically, getting to the market is one of the most important factors in ensuring that market is successful. And you can't be a healthy market if you can't get to it. So thank you, and I'd welcome that from you.
The thing that we find from our research time and time again is that high streets rely mostly on little and often shopping rather than filling your boot shopping. It's not like this sort of the suburban Sainsbury's model, if you like, or there are other supermarkets. But I think that little and often access is about high streets having the offer that is relevant to their local community, having the kind of public transport connectivity that can enable you to go back with a shopping bag or two rather than a bootload. So I think there is, and I recognise that in outer London that might be slightly different, but I think it is important to see that, research has shown time and time again, it's the little and often shopping that sustains our high streets.
Well, I'm in agreement that, inner and outer London are different places. The previous mayor recognised that with the Outer London Commission, which seems to have withered on the vine. They are different places. They require different things. I used to live in Hackney. Virtually got rid of the car, almost got rid of the car, didn't need it. Used to wander down to the high street, buy all my stuff there. I now live in Barking. I need a car. I need a car to get to the high street. It's as simple as that. And it's not, it's about different solutions for different places. And I'm worried about the one-size-fits-all effect of the parking restrictions in the London plan, actually meaning that outer London high streets have suffered a little. And I'm not caricaturing there's everybody turning up in a car. Of course they're not. But for some people, some very vulnerable people, that motorised form of transport is really quite important. But thank you. I would look forward to seeing an evaluation. Thank you.
Thank you, Senator Member Wilson. We're going to have to move on.
Thank you. So my question is to you, Harry. So after listening to what we've heard about a kind of evaluation of the existing London plan, is there anything that you would like to see from your perspective and the work that you've been doing in Brent, anything that you'd like to see in the new London plan, whether that's continuing with existing policy or any sort of changes or amendments to what you'd like to see in the new version when it comes out later this year?
That's a good question, and actually this is a great opportunity to think about that before. I think from a strategic perspective, the regulatory policies probably do as much as they can. So E9, I think, does as much as it can to set the framework for our own policies. So I can't think off the top of my head of much of a change that we would need. There are other priorities, I think, for us with the local plan going forward. But I think support the great work that you've heard that Gerard does on the data collection and that kind of thing to support our evidence base. That is a hugely invaluable complementary piece of work to our own evidence, and I think it's the processes that we go through to in plan making, which I think is where the most value comes from my perspective. So I think continued dialogue with the GLA on evidence gathering around whether it be hot food takeaways or adult gaming centres or betting shops or anything like that would be most useful for us, I think.
Thank you. Assembly Member Best.
Apologies, Chair. I need to leave, so I need to be at another meeting. So unless there's a specific question to me, I'm going to send apologies.
That's fine. We were aware, but I think we know that Tim and Gerard can take any questions that may have been for you.
Thank you. Apologies.
Thanks. I think this is the last one anyway, right? But, I wanted to come back on the lifting the car restrictions on the new London plan, and it seemed like Gerard, you said if it was something the Health Committee wanted you to do, you'd look into it, but it's not something that's being looked at already.
As I say, I'm not aware as to whether it is being looked at or has been looked at this present time. I would need, as I mentioned, to liaise with my colleagues in Transport for London to see if, given that it's particularly in relation to parking.
But it's the London plan.
It's
in the London plan. We're not talking about TfL. We're talking about the London plan.
In terms of the London plan, mode share.
Well, the London plans, particularly on healthy streets, talks a lot about reducing cars on high streets. It's the London plan, it's not TfL.
That's right, but we work very closely with Transport for London when it comes to monitoring the healthy streets approach. We don't rely on our own resources. We work very closely with Transport for London. It's not my particular area of expertise, so I would need to defer, and we can report back on that. I'm not able to say at this present time.
It's just a very specific question. We don't have that information to our fingertips, but we're very happy to take that away and come back to the committee.
Okay, but the draft plan is due when now?
In July.
In July.
Yeah, and it's just that we don't know whether that analysis has happened. We can't give you a definitive
So in
answer.
July, which is a few weeks' time, we expect to have a new draft London plan, which is going to have consequences for the economic centres of every borough and high streets. But we're not sure that whether the limiting of car use has had an effect.
Myself and Gerard can't tell you that definitively now, and apologies, the London Plan colleagues that are leading that aren't here today, but we're very happy to take it away. I'm just saying I can't confirm or deny that, and Gerard is saying he can.
It is a really big question, and you must have heard it from retailers, because I hear it every single day from retailers how much of an impact it's had. And I do contest a lot of the data that you talked about, and there's also data that shows places like retail parks are doing so well because they offer ample. So there's a lot of conflicting evidence. So I would contradict you on that anyway, that there's a wealth of evidence. But it is what businesses are saying. We're a month away from publication, and to not have a definitive answer on, that's a really big question. And you kind of stated there, Louise, that you believe that it was those those little and often shops that sustain it, which I think you were suggesting is on foot. And that shows kind of to me where your head's going, is that that's where you're kind of thinking, is that it's okay that the shops can do without the passing trade from cars or people pulling over to just run in the shops and grab something. And I'm just concerned that a month away from publication, it seems a little bit late in the day to say we'll go away and check whether it's actually harmed the economic centres where businesses are telling us almost every day it is.
I mean, there will be analysis there. We just can't point to it, Assemblymember Best. But I mean, what I was quoting was research that's been done over the years. It's not specifically in relation to the London Plan evidence base, just to be clear.
Thank you. So at that point, can I now thank our guests for attending and your answers to our questions. That concludes our discussions on healthy high streets. Can we note the report and today's discussion? Can we delegate authority to me as chair in consultation with party group lead members to agree any output from the discussion? Louise, I know you had to go, so feel free to go at this point. And other members, we won't be too long. Can I ask the committee to note its work programme and its meeting dates as agreed by the London Assembly at its annual meeting held on the 11th of May 2026? Again, can we delegate authority to me as chair in consultation with party group lead members to agree any output from the rapporteurship on the community use of school sports facilities to support exercise and reduce health inequalities for young Londoners? And the date of the next committee meeting is scheduled for the 3rd of September at 2 p.m. in committee rooms 2 and 3 at City Hall. I have no other urgent business and I therefore declare this meeting to be closed.